Welcome back, brave hearts, to the Doc of Detox show. I'm Dr. Darrell Wolf, and today's show is Cellsonic. That's right. And you're going, oh, well, what's Cellsonic? And oh my gosh, here comes another product infomercial. I don't think so. Welcome to the greatest scientific breakthrough in medicine. And this is a live Q&A. So please send in your questions and ask Dr. Professor Andrew Hague all your questions. And understand something, everyone. Yes, when I was of the age of 25, I was selling Rife equipment. I sold Lahosky's equipment. I sold Tesla equipment. I sold everything. I used to actually have a clinic in Toronto where we used to use ozone and teach people how to inject ozone. So let me just tell you a story about energy medicine. Back in the late 1800s, okay, early 1900s, I'll be bringing the professor on in a second. I just want to set the stage here. Not only did they strip 110 colleges and universities throughout North America, thank you to the Rockefellers who gave $100 million to the AMA that was going bankrupt in 1910 and said, if you can destroy 110 colleges and universities, you will become the strongest health organization in the world. And we will never stop funding you because you will only be allowed to sell pharmaceuticals made by the Rockefellers and also by, it slipped me right now, but let me think, it'll come to me. One other group, the Carnegie Foundation. So I did a video called Medical Mafia, which you can get up in my library at the Doc of Detox. And there's the history, there's the truth, there's the facts on how they raped you of your God-given right to heal, how they raped you of nature. And I mean raped, okay? They raped and pillaged and they burnt books because back then there was no computers. And here's the deal. The same time that they did that, you know what they said? Energy medicine was voodoo. Now tell me that religion doesn't separate men, or human beings from their spirit. Remember? They do, don't they? We are spirit beings having a physical experience on this planet. Now I'm not telling you all religion does that, but guess what? Tell me that the medical system talks about spirit. Tell me that they talk about energy level. Tell me that they talk about frequency. Tell me they talk about light. Tell me they talk about high vibrational foods, high vibrational beliefs, because your beliefs create everything. Tell me that they do that. No, they don't. They do not believe in the invisible creates the physical. But guess what? Did you know that every energy device, electrical device they use, guess what they test? They test your spirit energy. They do. Come on, when they use ultrasound, okay? When they do x-rays, okay? That's what they're doing. They're testing energy. They're seeing energy fields. But they won't recognize that. So this is what I'm telling you, that not only in the early 1900s did they get rid of herbs, chiropractors, massage therapists, naturopaths, osteopaths, homeopathy, everything. They closed every school down. It took them 10 years. Took them $100 million. And the actual doctors that were saying that they had to close them down weren't doctors at all. The whole thing is a fraud, just like what's going on today. So the reality is, if the first time in your life that you will recognize your power is when you recognize that you are an electromagnetic light energy being. You're not a doing. And understand, whether it comes to conversation, food, drink, it's all about vibration. Where's the frequency? And everything that you eat and everything you drink has left your body. Did you get that? Every physical part of it. None of the physical that you eat actually creates a physical body. Boy, there's a mind blow. But guess what? The frequency that it leaves behind could actually, when it comes to thoughts, create a baby when two come together in love. Or you could create a tumor because you're running a hate-fear program. Or you could just stress yourself out. Or you could get a headache. It just goes on and on and on. So don't tell me that energy medicine isn't the future. Einstein stated that energy medicine would be the future. But understand, the greatest energy medicine device is your spirit. that lives inside of you and all around you. That's why you can feel someone standing behind you and you feel like your hair's standing on end. I can feel there's something. Oh, hi. That's right. That's their energy field. And your energy field is the most important thing that you need to protect. And when you do not know how to filter out toxic food, toxic people, toxic relationships, toxic drink, and toxic conversations, then you become it. So why are we talking about Cellsonic? Well, because understand something. Did you ever use a device that would actually be able to create an impulse that could actually, in one treatment, I'm not telling you all the time, be able to turn around a disease? Because a disease is frequency. You can turn cancer on, you can turn cancer off with a frequency. And I'm not saying this. Science says this. Don't believe me. Go do your research. But that's the problem. We don't do our research, do we? And I'll tell you what, we don't do our research. 81% of the Canadian population has had their first V because of an invisible, non-apparent C that never did exist. So the reality is what you think you become. So I want to get you to think about being an electrical magnetic being and then charging your system up with the most powerful, beautiful frequencies that you could ever get your hands on. So let's begin the show. Good day, Andrew. How are you, sir?
We're doing very well, Dr. Wolf. Thank you very much. And that was a good introduction because it's true what you say about going back 100 years. Medicine was turned upside down by the Rockefellers and the moneymakers. How have I got to where I am? Because I used my own money. I've not been dependent on anybody else for help. And we didn't actually set out to make a machine that would do what we now know it can do. It was very simple. I said, look, the medical's very complex. It's very difficult getting decision makers in hospitals because you've got whether it's the doctor or the treasury that's making the decision, we'll just go for the beauty market. And from that, we have discovered what our machine can do. And it's amazing. Shall I take you through the history of discoveries?
I want you to do that. And I want everybody to know this, that we have a Cellsonic machine and that we will and are treating people, and we are treating them properly, because this is the only way to treat, is with frequency, with light, because that's what we are. We're light energy beings. But you will have to come to Ixtapa, Mexico, where you'll have to suffer the beautiful sunshine, the pool, the beach, and from the minute you wake up until you go to bed, the beautiful organic vegetable juices, fruit juices, blender drinks, avocado, coconut meat, coconut milk, and you're going to have to deal with me wanting to give you a hug. So that's the reality. So I want you to embrace one thing, that you are everything and you are important. But guess what? Until you change, nothing changes. Is that right, my professor?
It is. And people are beginning to understand this because for so long, from being children, we were told, take your medicine, it'll make you better. But there's more to it than that. And a lot of people are becoming very distrustful of the man in the white coat who just says, take your medicine. And then they don't get better. That's what's happening. Now, when people say, can it do this and can it do that? I say, well, that's the second question. The first question we've got to ask is it safe? And the answer is always yes. There's no side effects with Cellsonic. The technology in its early days was very much more high powered than what we're using. And it was blasting kidney stones right in the kidney and fragmenting. That's about 40 years ago. Millions of patients in every country of the world have been treated that way. And no side effects. If there'd been any bad news, we would have all heard about it, and it's not happening.
So can you, do you mind, sir, can you tell people how many volts this produces?
In the machine,
yes,
taking, in your case, 120 volts from the socket on the wall, we then flashed 25,000 volts across a 1 millimeter gap in what we call the shock gate. And that produces two things. A big sound pressure pulse, which lasts 1 billionth of a second, 1 nanosecond. And in so doing, there's also an electrical field from that. which is not very powerful, but it's a high voltage, very short duration, of course. And in that bang and those frequencies, there are all the frequencies that are needed, that are covered by the body, probably more than they're covered by the body. And the responses the body has to that, that's what it is. It's tack, 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 4 times a second. Has surprised us all. This is the interesting thing, it's discovery. We didn't say to ourselves, we've got to make a machine to do that. We just made a machine for the beauty market and found out what it could do, because it was doing it safely, easy to work, didn't need to spend 8 years at a medical college to do it. So long as you're sensible, this can work in poor countries where people do need help, where medicines have to be kept in fridges all the time. We don't have that problem. It could work off a little solar generator and batteries. This is a technology for the world.
Well, you know what? I think what's the most amazing thing, when you told me that this thing will do 25,000 volts, and we know that if you put your finger in a socket at 120 volts, you could cause a seizure or a heart attack or a stroke. So, I mean, right off the bat, I think that's totally amazing. The next thing is guess what? You started off just doing it for beauty, and guess what? Now we understand that beauty is more than skin deep, because that isn't it. And we also, everybody, you got to understand this, okay? Now, whether you want to believe this or not does not matter. But the reality is, if you do your research, matter is not the most important thing. It's the frequency. And understand, the government, the medical system, and every other system wants to hide that from you. You got to understand, what is the greatest healer? The sun. Isn't it? Yes or no? That's right. Because it carries a rainbow of frequencies. Oh, you didn't notice that? When it rains, a rainbow of frequencies. And understand something. The professor actually tripped on something that can actually go in. And when we start talking about the questions we've already got from people about this condition, that condition, and when you hear these answers, understand something. You could, okay, so here's the deal. This is why that I make a guarantee that whatever I carry, whether it's my humic fulvic, whether it's my ionic calcium product, whether it's iodine, I have the best in the world, because I don't test what's in a product. I test the frequency that's in the product, because it's always about the frequency. Somebody can tell you, oh my gosh, we have all this in our product. And you know what? I'm going to tell you right now, this coming week, we are putting our C60 on sale, our hemp C60, our olive oil C60, and our coconut oil C60. And there's not another C60 in North America that will even come near ours, because it's all about frequency, and most of it's fraudulent. But they'll tell you the same story that I tell you. So the reality is this, it's all about frequency. And at the end of the day, remember what I said, the physical leaves the body, and whatever's left behind is the light and the energy. So let's talk about that. And then, doesn't it boggle your mind? 25,000 volts coming in. How does the body accept it as love? How does it do that?
I don't really know.
Oh yeah. So it's like, you know what? If you ask an electrician, okay, how does electricity travel? They can't even tell you. They can't even tell you how it does. It's in the wire, but we can't tell you how it travels.
No, and don't touch it to find out either. The voltage in the machine stays in the machine. Now, the machine is safe. I've told you the effect on the body is safe. But just let me, because in practical terms this is important. I was doing an exhibition in Kuala Lumpur in Malaysia on the exhibition stand. And these exhibition stands were all wired together with loops of wire from one to the next. And I'd taken the machine out there to demonstrate, and it did not work. And I was getting very angry. And when I got back and spoke to my man at the factory, I said, you sent me a duff machine. He said, no. He says, I think you'll find out that the earthing on the exhibition stand was inadequate. And the machine detects that. If it's not earth, it won't work.
If it's not, what do you mean if it's not earth?
I don't know about America, but in Britain we've got pins with 3 sockets, plugs with 3 pins on.
Yes.
An out and an in and an earth. And the earth has to be connected literally to the earth.
I got it because it's the grounding.
Yeah.
Grounding.
Yes. Grounding, that's the word. Now, if that is not there, the machine will not work. It protects itself, thereby protecting the user. So you're talking about high voltage, but you're not talking about anything that could endanger anybody. It's absolutely safe. All that the person feels is, and nobody's ever found the right word for this, is they feel something. It doesn't hurt. And the other funny thing, and you're smiling, and even just as I'm going to mention this, I think I know what you're going to, you know what I'm going to say. I've had reports from the users about patients. They look forward to the treatment. Now, I thought that's because we've got some great guys doing the treatments. It might be that as well. But I think there's something goes into the body, up into the brain, like a happy token. What's going on? Something right is happening.
I can tell you what I believe. I believe that you're actually going in and you're waking up the mitochondria, which are the powerhouse of every cell. And you know what? You're waking the mitochondria up out of a coma, and then you're triggering ATP. And if you can trigger the ATP to be produced in the mitochondria, remember something. Everybody get this. It's all about energy. Okay, watch maybe this fall or this winter. They're going to cut off your energy, cut off your food supply, just because they know they can. And what does that do? That disturbs you. So guess what happens on a cellular level if you get your food supply cut off and you don't make energy? Well, guess what? That's why sick people don't get well. Sick people will never get well because they need energy. Well, how do I get well when I'm sick? Well, you're chronically sick because you didn't know how to look after yourself. So guess what you did?
Yeah.
You actually caused dysfunction in your mitochondria. And now you don't have proper communication. Without proper cellular communication, you've got information breakdown, and you need, guess what? That extra boost of energy is like this. Somebody who's constipated, it's like getting the cork out of the bottle and getting flow. What do you think?
This is right. And I learn as I go along, and I learn from my customers and their patients. And I did a tour of India, and I was introduced to a lady at the big clinic in Hyderabad. And she was there with her son. The son could speak some English. The lady couldn't speak. She was Telugu, wasn't speaking English. She was being treated for kidney disease. She was on dialysis. She had to go 3 times a week for all her blood to be cleaned. And it's a very boring process. But with the Cellsonic, aiming at the kidneys, everything was being cleaned, and she was coming off the dialysis. Now, this was thought to be a one-way process. Once you're onto dialysis, what's the next step? A kidney replacement, a kidney transplant. We were showing that that was not necessary. But to me, the interesting thing, as well as the recovery of the kidney, was the fact that this lady always looked forward to the treatments. It made her feel a lot better. Not just the treatment, but as you say, the energy is being put back where it ought to have been. No, that's what's going on. So maybe I should start saying there is a side effect. It makes you feel happy.
Right. Well, yeah. It's all about frequency, because guess what? If I can just say this, it's not really the topic, and I'm kind of off topic, and we'll come right back. But image creates thought. Thought creates frequency. And if the image was a negative one, then it's a negative frequency. So if you're putting in positive frequencies, then you're creating beautiful images on a cellular level. End of story.
Yeah, that's right.
So I've got Jim here, and he says, so are you trying to tell us that this works on all chronic illness?
The word all, I have to be careful.
Yes.
I think so. We know a lot already. And we tread carefully. We're not being bombastic. I cannot say, until I'm sure it works, that it works. You see, the next frontier, I think, is going to be the brain diseases, the Alzheimer's, stroke, Parkinson's, that sort of thing. And the information I'm getting verbally from my users is that they've tried it on a few patients and it's looking good. Now, that's not sufficient for me to write a paper and proclaim that we've got something there, but that's where we're heading. Now, things that we've already done, great success on cancer, nerve repair.
Okay, but you're talking about, you've had great success on all cancers, correct?
Yeah.
Okay.
Yeah, because it doesn't matter where in the body the cancer is. It's behaving as cancer.
Yes.
Under a microscope, it will look different, whether it's grown on the pancreas or it's grown on a breast tissue, whatever. That looks different, but it's behavior.
But cancer's cancer. I know there's over 110 different cancers if you look at the medical system. And the reality is when we help to train and create the perfect day for people to heal, almost 80 to 90% of the protocol is exactly the same for every cancer. Because even cancer is just a symptom of being out of alignment, but people don't get it because there are no diseases. Diseases are just names to try to let you know where the misalignment is in your body.
Yeah.
And diseases
That's
are just blocks, like I just said. And the Cellsonic works like taking the cork out of the wine bottle. Because everything is a block. Every disease in the human body is a block. I don't care what you're talking about. Every disease is just a block. First, it's an energy block. Then it becomes a physical block of calcium scar tissue, okay, or crystallization, right? And then mutation, but it's still just a block. And energy is what transforms the block, because energy is the frequency that actually helps to recreate. So what the Cellsonic does is it does healthy decomposition of unhealthy tissue to recreate and restore, because we're not really getting rid of the tumor. All we're doing is restoring it back to healthy, vibrant tissue.
Yeah.
Yes.
Yeah. In cancer terms, what we're stopping is the profuse replication of mutating cells.
Yes.
We're getting them to go back to the steady replication of healthy cells.
Mm-hmm.
What ought to be mentioned at this stage is when a person presents with breast cancer or lung cancer or something like that, we always assume that there's cancers elsewhere in the body. And we check for that and we treat everywhere that we find a cancer. Cancer never stands still. And people who say, I've got it on hold, I warn them. I say, no, you need a treatment quickly. Don't just think it's stationary. It's progressing, but you can't necessarily see it or feel it until it gets big enough and it hurts you. So cancer's it's not difficult. It's easy to do, but treat it with respect.
Yeah, because you have to treat it with respect, because believe it or not, on an unconscious, subconscious level, you weren't respecting yourself. And it's saying, you owe me. It's like a Visa payment. You haven't been making self-love, self-care payments each and every day. You only have to do gentle baby steps. But if you don't know how to do it because you've been programmed like everyone else, that's all a chronic disease is not loving, honoring, respecting your body, but you didn't know how. So it's not your fault, but at the end of the day, nobody's coming to save you. You have to save yourself. You have to change yourself. So I have a question here. Lucy says, I have osteoarthritis, okay, and I have rheumatoid arthritis. Will this help?
Yes, it will. This was a very early discovery in the technology, and we can go right back to the beginnings of breaking kidney stones when the urologists were saying, if we're not accurate aiming at the stone and we hit bone, then what happens? And the bone microfractured and healed very well.
So when you say, I just want people to get this, microfracture means it's so tiny, people, that when it causes a little bit of stress to the bone, it causes the bone to become stronger, right?
Yes. Osteoblasts, as I understand it, are the building blocks of bone, and more osteoblasts are formed. Now, especially in the ladies, as they get older, the bones can get more brittle. And the Cellsonic will work on those bones in the way that that movement and loading on bones will help as well. Now, arthritis, we one very interesting case where the man was treated in all the areas where it showed up that he got cancer, and then it was about 2 weeks later, and he'd been checked at the hospital that all his cancer had gone. Amazingly, nobody could understand it, but the guy said, you know, the funny thing is all my arthritis has gone as well. So where he got these aches and pains, that they'd been treated because they seemed to be adjacent to where he got cancers. The field of projection from the machine covered both cancer and the arthritis. That was done. The osteoporosis is all done. Those are not, to our machine, difficult conditions to deal with.
Absolutely. And just so you know, everybody, I've got quite a few people here asking a question. So everybody, the information on Cellsonic is actually on my website. So what you can do is you can go to store.docofdetox.com and then click on EMF/energy, and you'll see Cellsonic there. All the information is there. And also I have somebody on here who's a practitioner saying, how can I get more information? Just call me at 855-900-4544 extension 5. Yes, we do look after sales of Cellsonic at the Doc of Detox, and we look after training you too, sir. Okay? So if you want to give me a call to do that, that'll be fine. And somebody else is asking, where do you get the treatments? Well, we're doing them in Ixtapa, Mexico. You can call my extension again, number 5. And can I go back just a second to the osteoporosis? Understand something. Osteoporosis is blowing out of the water because people still believe that cheese and dairy and all these other so-called foods that the government pushes down our throat are good for us. But the reality is that, understand something. There's only one calcium product that works on the planet, and it's called ionic calcium therapy. You can go read about that in my library. Just click on the ionic calcium guide and understand something, everybody. If you're doing Cellsonic and you're doing ionic calcium, I do care for you. I do. But I don't care if you've got osteoporosis and your bones are crumbling. You can totally reverse this. So understand the human body's amazing, and it's all about ions, calcium ions. We can flood your body with them. Calcium ions do over 120,000 different processes per second, and with the Cellsonic, it supercharges the bone making and breaking. And when you put these two together, you can't give me somebody that is a lost cause. End of story. And I'm going to say that right now. There's no lost causes here. Okay? There's just loss of truth. Go ahead, Andrew.
Well, as I say, it was a process of discovery. And the orthopedics were working on the bones, and the physiotherapists were then looking at the movements. In fact, it later turned out that the orthopedics weren't happy with Cellsonic because it gave physiotherapists the power to repair bones, which had been the exclusive preserve of the orthopedics. Those patients who got bone injuries, where they'd also got cuts from motorcycling or skiing or something like that, had these huge wounds, were then seen for the wound to heal well, better than expected.
Sorry, Andrew, I need to break in. I don't know if it's on your side or my side, but we keep getting people saying that they cannot hear. So it's constant. So we've turned it up here. I don't know if you have to turn it up on your side. I'm not an IT guy. Okay? I'm just letting everybody know that, to put it out there, that we've got about a dozen people saying it, so it must be true. I want to ask you a question. I've got Jennifer here, and she says, I have diabetic ulcers. Will it help me with my ulcers? Because you were talking about wound healing. And will it do anything for my diabetes?
Yes and yes. About 15%, it might be more, of diabetics get wounds that crack open on the extremities, usually on the legs, below
Yes.
the knees.
Yeah.
And it will help on that. There's no question about it. And that has been done for more than 30 years now. No problem. Big wounds can take a long time to heal. Now, the speed at which they heal is governed by nature. We can't cause skin to grow faster. Nature has a certain speed limit on that.
Can I say something, Professor? Can I say one thing? I just want everybody to stick this in your pocket. Using the Cellsonic and then spraying infinite iodine on, which is the only pure iodine in the world, okay? And then using C60 MCT coconut oil with the Cellsonic will turn around the ulcers, and I'll give you a money-back guarantee on that. Okay? Go ahead.
That's great.
Yeah.
Well, what is known, because this was measurable, they shoot the Cellsonic onto the wound and around the wound.
Yes.
Now that's important, because if you've got a wound that's 6 inches across, and many are, then you're going to treat an area that's probably as much as 12 inches from one end to the other, so that the infection below the wound is attacked. And it doesn't matter whether you don't need to know what the infection is. It can be germs of viruses and bacteria and parasites. They will all get killed by the Cellsonic.
Can I say something, sir? I just want everybody to know, I'm not trying to interrupt him, but understand is something, everybody. Just like Louis Pasteur said, the bug is nothing, the terrain is everything. And as soon as you create a different frequency, you create a different environment, remember something. Okay, what came first, the mosquito or the swamp? The swamp. You get rid of the swamp, you get rid of the mosquito. Because we don't realize it, but the bad bacteria that you call bad, the fungus that you call bad, they're all there to decompose the disease. So bring up the vibration and tell those guys to get packing. Go ahead, Andrew. Thank you, Professor.
Yeah. The infection is killed. And what's put on a wound will penetrate only so far. The Cellsonic goes deeper, as it was originally intended to do, to go about 150 millimeters right into the kidney to break the kidney stone. So penetrating is what it does.
And it also,
Then look at
before, sir, you also were working with cellulite, because it's amazing for getting rid of cellulite, because cellulite is just, it's toxic, non-circulating tissue. That's all it is. It's highly toxic tissue. Go ahead. Didn't mean to cut in again.
And the quality of the blood improves, because the brain has to sense that there's a treatment taking place. Now, this is important, and in the training, I'll expand on this when we talk to the people who are learning how to use the machine. But the patient has to feel it, not be hurt by it. But if they're oblivious to it, just turn the energy level up a bit. The normal setting is 4. The machine is set from 1 to 10, but 4 is usually sufficient. In that blood will be more oxygen. That's automatically done by the body. There's more nitric oxide put there. And there are stem cells. Immature stem cells are stored in the body, usually in the biggest bone, the hip bone. And the brain says, okay, now I know something's wrong. How it didn't know that is interesting. I'll come on to that if you want me to. So it instructs
I do want you to, Andrew, because I want everybody to understand something. That when you said first you've got to say hello to the brain, because the brain is because it's the chemist. It's the chemist. So it's going to decide what chemicals and what hormones are going to be delivered at lightning speed. So, and remember something, everything is about communication in the brain. And if you're communicating the highest frequency of communication, then the brain goes, I'm here for you. Thank you for the message.
Yeah, and this will all be about thresholds. Now, with the stem cells going into that area, the body knows what new tissues are needed. So it brings up the stem cells, and they will form themselves so that new skin can be developed, new nerves can be developed, and new bits of other tissues and so forth. But let me take you on to this idea of thresholds. How is it that there's blatantly a problem? There's a huge wound, and the brain only becomes aware of it when it's zapped by the Cellsonic. The brain must have been oblivious to that. What sort of brain is this? It's the brain of a creature, the Homo sapiens, that was bred, that evolved in a rather rigorous, difficult lifestyle. You get out of your cave in the morning and you've got to go hunting for food. And if you trip over a stone and scratch your leg, so that's you've got to be able to tolerate that. That's how it goes. And occasionally, every now and again, you fight a tiger and have a big wrestle with a bear and so forth. They were tough guys back in those days. So there is a threshold of pain tolerance set in the brain that's quite high. And the Cellsonic breaches that threshold, allowing the brain to get a message that something needs to be repaired. So just the sound alone is not going to do it. The brain has to do it. But the brain's got to be said, okay, now I know you're actually a caveman. You're not a guy who sits at an office desk 10 hours a day. You're a caveman, and your body's behaving like a caveman. And remember what you're saying about the food. Those guys way back were eating organic food that only was organic food. And they didn't overeat. unless they happened to fall upon an elephant in a trap and that they could eat an elephant for a week. We are still cavemen. That's the message that we have to understand. And anything artificial, like drugs out of a laboratory, are poison.
Absolutely, sir. So now I have Sheila. She says, I broke my leg and the bones are not coming together. They're close, but where the break is, it's not totally together. They want to put a plate on either side with screws. Is there anything that you can do for me, because I do not want this surgery?
Yes, and it works. Below the knee, you've actually got two bones. And what tends to happen is one of them will join up and the other's not quite joining up. And as they sit there, the Cellsonic will cause the bone to grow, bridging a gap of about 6 millimeters, a quarter of an inch. Now, where it's all a bit totally distorted, what the orthopedic surgeon will do is put plates in position and sometimes wires going from one side of the leg through the bone out to the other side to hold the bones in position. But then they're faced with the problem. Will the bone on its own, of its own accord, grow? And it doesn't. This is called pseudotrosis. Zapping it with the Cellsonic causes that bone to grow. Absolutely makes it happen. And I've got a very nice photograph which Dr. Rodriguez sent me from Peru. And I think it's a lady. She's laid back. Anyway, it looks like a lady. But we're looking at her leg, and there's metal pins going into her from all directions. But he's zapping away with the Cellsonic. If anything, this metal actually helps, because the pressure pulse going in bounces off, is reflecting off the metal, and it goes somewhere else as well. So no hindrance at all. It is if this particular lady has got no cut skin, she doesn't want to be cut open. Now that makes a lot of sense, because as soon as the skin is opened, there's a chance of infection going in. So we don't want that to happen. And if the bones are aligned and can be held in position, then you go up to energy level 10, and you've got your two bones here. And you aim at that end, you aim at that end. They're held in position. And after the treatment, they put the plaster cast around it, and it's held there for 8 weeks. Normally 8 weeks. Minimum 6 weeks, but normally 8 weeks, to cause bone to heal. No problem.
Okay, so I'm going to tell a little story, if that's okay. So my partner, she didn't know that she had osteopenia, and what we did was we used the ionic calcium. But anyways, we took her to the hospital. This happened when we were down in Texas, and they said that we got to rush her up to the hospital, up to surgery right now. Okay, she had a C fracture in the tibia, and then in the fibia, she actually created a fracture that was 2 1/4 inches long, believe it or not, and it was 1/8 of an inch wide. And they said that's impossible. The body cannot heal it. So with doing the energy medicine and with doing the ionic calcium, okay, because I said, what are you going to do with it? They said, well, we're going to put plates in, we're going to put screws in, and it's going to take about, how long is it going to take? Well, it's going to take 14 months to 16 months. Well, guess what? It took us 11 months, and we didn't get the surgery. And all we did was the energy medicine and ionic calcium, and that's that. We have the actual proof. We took the pictures before, we took the pictures after. So I know it to be true. So on a personal level, I know it to be true. I know it to be true with other patients as well. I have here, it's Lily, and she says that I'm continually getting infections. What would this Cellsonic do for me?
Where?
Lung infections. Sorry, lung infections. Lung infections. Yeah. Okay.
Yes, and you have to, and it's not difficult, understand what the lung is. It's a vessel with lots of tissues in it, and what's gone in, the only way out is back up the throat.
That's right.
If it's the digestive, what's gone in through the mouth can come back out through the rectum. But in case of the lungs, when we treat the lungs, the end result can be a lot of coughing and spluttering. And people, oh, what's happened to me? I said, don't worry. that detritus in there is being thrown out. You've got to get it out. So cough it up. That's all right. And it's safe to do. We always were quite careful at first because the heart is in the same area and we didn't want to disturb the heart. And my normal advice is you do 50 shocks and stop and just make sure that the heartbeat is all right. So we don't want the beating of the machine, the tack, tack, tack of the machine to dominate the heart. Having said that, this is how these discoveries take place. The report we've got on COVID, which is a lung treatment. I said to the guy, what did you do? Oh, I gave her 450 shocks. Energy level 10, that's the highest. Across her back. She's all right. Yeah, she's fine. So there you are. Me being cautious and what the guy actually does in the field, so to speak, it worked. Now, I'm still cautious. Yes, we can treat the lungs and treat from the back, from the front, from the sides, because these pulses are traveling through water. In the shock eddies water, the body is 80% water. They don't travel through a gas. Now, air is in the lungs, obviously, it has to be in the lungs. And what we're wanting to damage, the germs, the infection in the lungs, are sitting on the wall, on the tissues of the lungs. We need to get at them. If we go into that side, but the little germ is on the other side, we can't jump that gap. We've got to aim from the other side. So the patient will be treated from front, back, left, and right. And it's safe and it'll work.
Okay, thank you. Nicola, I would love to know what causes nephrocalcinosis. I've been told that too much calcium in the blood. If I can answer first, I just want to say this. That illness is actually caused because you're too acidic. If that calcium wasn't in your bloodstream because you are so acidic, if the pH were to drop any further, you'd go into a coma or die. So when the medical system sees it, they, oh my God, we got too much calcium in there. But what they're not looking at is they're not looking at the whole body. They're not looking at your stress levels. They're not looking at the inflammatory foods you're eating. They're not looking at your constipation. They're not looking at your clogged liver. So the reality is they don't look at you as a whole. They look at one area and go, oh my God, okay, hypercalcemia. Well, it's not hypercalcemia. It's called saving your butt, okay, until you know what you need to do to bring down the acidity, the inflammation, the infection, so you can bring up the alkalinity back into your body. So anyway, she wants to know if this would help.
Yes, it does help. But I think indirectly rather than directly. Now, I get a lot of information from Dr. Merle Luden, who's written a couple of books, and I've been honored to write the preface for one of them. And he goes a lot into getting that pH value right. And he tests his urine with litmus paper to make sure the alkaline acid balances are right and all those sorts of things. On a personal level, I think you could almost say I'm addicted to cheese and milk. I love it. But there again, there can be a big difference between what we can buy in England and what you have in America. Now, I know some of the foods are highly criticized in America by people who understand nutrition. So on that, there could be a difference in the markets. So what I enjoy here, you haven't the opportunity to be able to buy in America, in Mexico, Canada, whatever. I don't know. Maybe probably better in Mexico.
Yeah, but I would never eat animal products like dairy and cheese anyways, because they constipate me. I have blood type A, and we already know that casein, which is in all dairy, it actually becomes addictive to the brain, but it becomes poisonous to the body. So you might be a blood type O and you're not feeling it, but you're going to still get effects, Andrew, unless you're using your machine and keeping the frequency high.
Well, people say to me, and I'm a lot older than you, Daryl. I'm 75. What do I do to keep fit? Do you use the Cellsonic? Well, I have a different machine. What is it? It's got pedals on. It's my bicycle. And even this afternoon, because it's now in England early evening, I've been out on the bike. I'm burning a lot more energy. But one thing I would add in terms of diet is every day I have a big orange. Vitamin C, not an orange drink not something with added sugar. I have an orange, and I love it. Now that's acidic.
Yeah, but but it goes alkaline in the body. Just like lemons are the most acidic fruit, but they go alkaline in the body. So there's a difference. There's acidic foods that go alkaline because that's nature. Anything that's
Yes.
man touched, man made, and it's acidic, it stays that way, and it doesn't have the energy to transform into anything else. All
Yeah.
right, so
Cider vinegar, apple cider vinegar, highly recommend.
all right, I have here. Here's a good one. Here's a good one. So Susan says, I've got toenail fungus so bad um, that my toes are brown green. I do everything to try to get rid of the toenail fungus.
This is lovely. This is easy. I had it, and I'd had it for years. Don't know where it came from. Swimming baths or somewhere like that. It's like verrucas and athlete's foot and so forth. But the toenail fungus is a damn nuisance because what you buy at we call them chemists, you call them pharmacists, doesn't actually get under the nail. You're led to believe it might, and then you're given sandpaper to rub off the nail. Right. So I was in the workshop with my machine, and I thought, I wonder if this will work. And I tried it on my toes and then forgot about it. And 2 weeks later, I realized all my toes were smooth. They cleared up. And I've stayed that way for 20 years now. It is easy. It is a one-off treatment. Some gel on your toes. Gout. If you got gout, if you got some broken bones, toenail fungus, you do the whole lot in one go. That is an easy one.
That's called wham bam, thank you, ma'am. Hey, but if I can say this, Professor, just so everybody knows, we don't get fungus from wearing boots that get wet. We don't get fungus from outside. We get it inside, and it actually comes from the large intestine. It's called leaky gut. If you've done antibiotics or you eat things, drink things, any type of animal foods that have been fed with antibiotics, they actually disturb the yeast in the gut and turns it into fungus. They become drill bit predators, and they drill holes, and you get the fungus into the blood, and it becomes systemic, and that's why you find it on your toes. And when you have it on your toes, and people are not going to like that, I'm going to say this, it's precancerous. So that person has a very good chance that they will pass away from cancer. You need to understand that you can get rid of it on your toes, but don't forget to go into your large intestine and fix that screen door in a submarine and turn the fungus back into beautiful yeast. Just like, if I can say something, just like when a tree falls and it starts to die, then what happens is the fungus takes over, and those drill bit predators will take that tree and mulch it up and bring it back into soil. So what happens when you take antibiotics, whether it's in your food, in your milk, in the dairy, or in the animal products, or you get it from your doctor because that's all they give almost every condition, you are going to take the yeast, turn it into fungus, and they drill holes through you, and then you start getting and really pooping into your pelvis and everywhere else. And the fungus goes throughout the body, and that's what's called candidiasis, and it's called systemic candidiasis, which is vaginitis, which is sinusitis, and that brings us to a lady here, and her name is Kathleen. And understand, people, go, before I talk about Kathleen, go take a look at my library and go to How to Become Number One at the Art of Number Two. It's a 6-hour masterclass, and it's free, and I guarantee you I'll teach you more about health in that 6 hours than you knew all your whole life. And that's the God's truth. It's logic. When it rains, you get wet. That's it. 1 and 1 are 2, not 11. So anyways, this lady here is saying that I deal with vaginitis, and I just explained it because it's pooping in your pelvis. It's a colon problem. But what can you do for vaginitis?
We can treat it.
And,
It's just to the machine, it's an infection.
right. Okay.
So you're aiming at that area from all directions. And it might be a bit inelegant, but it doesn't take much imagination to think where you can aim the machine this way and from the front and a little bit from the back and so on. And what doesn't matter is if it's aiming into other organs, it doesn't matter at all. That's fine.
Okay.
No, it will kill that infection. And the infection can be coming down from the bladder. It'll aim into the bladder as well and kill infections.
Well, everything's in the neighborhood. In the vagina, you got your ovaries, got your uterus, got your fallopian tubes, and I'm going to give you part 2 and part 3 of her question. But so you got your ovaries, your uterus, your fallopian tubes, and your bladder, and then you've got the last 4 inches of your colon, which is your sigmoid, and then your rectum anus, and they're all right in there. So if you don't look after your bowel, you're pooping in your pelvis, and that's where a lot of this is coming from. She's saying that I have vaginitis now, so I'm trying to get pregnant, and I've got scar tissue in my fallopian tubes. Would this help me?
Yes. Yes, it would. Have a treatment done by a doctor who understands the Cellsonic. And we've had a very good report on ovarian cancer. So this is at the extreme end of the problems.
Right.
And a complete clear up. And this was a lady treated by Sundar, the guy who did the very first cancer treatment on a prostate cancer. And the lady Heba, she gives her name, and she was very proud to be included in this report. So there's a photograph of her. And Sundar sent me a picture of her in a garden the day I'd actually completed writing it. He said, Hema says, add her picture to the paper, because she's cured. So 5 years after, this is Big Pharma likes this 5 years into that work. So no damage to that area, as you say. It's an area that big of the body. There's all sorts of bits and pieces in there.
Yeah.
No harm.
Okay.
That's important. No harm. Infection killed. Everything works. Fine.
Great. And she just commented again, and just yes, you can come to Extapa, and we're not going to be just doing that with you, the Cellsonic, and treating it with the Cellsonic. We'll be doing also Wolf non-surgical. We're also doing the ionic calcium therapy there. We also have other energy medicine devices, but it'll also be the diet, and it'll also be the sunshine. It'll be everything put together. You know, everything is about in a healing environment. So we will be treating everybody and everything from your nose to your toes and everywhere else. So this is Peter. Peter says, my wife first got a fibroid in her pelvis. Now she's got a fibroid in her left breast. What will this do for fibroids?
Treat those areas. And as you say, the effect of the machine, breaking up the tissues, sending messages to the brain, killing infection, sending better blood to those areas. That's what's needed.
Thank you. And I just want to make a statement here, if I could, everyone, and you need to get this. I don't care if you've got planned surgery for your hip or for the fibroid in your breast. I do care for you, though. Just understand this. We're going to lovingly go in and use Wolf non-surgical, where we're actually going to take that scar tissue that's so tight, that calcium that's so tight, and the crystallization. We're going to lovingly you got to look at a fibroid as being a fist, because it's angry. Okay? That's anger. And that's also what you're storing is fear and hate and anger in the body. But the reality is we're going to lovingly go in and we're going to untie the knot with Wolf non-surgical, open up the fibers, and that's going to take us only 20 minutes to no more than 30 minutes for these fibroids to go in there and lovingly do that. Okay? And then we're going to go in with the Cellsonic. And I'm going to tell you something. When you take Wolf non-surgical and you work on the body first in the area that you're concerned with, and you do the Cellsonic, you're going to bring it up tenfold. Now, why are you going to do that? Because it's always been about blood flow, lymph flow, and about the invisible, which is your energy flow. And you bring those two flows up, and if you can increase that flow by 30 to 80%, which we can do every time. And I don't care if you're talking about a cancerous tumor, we work around the area, and what we do is we work on the feeders. Every cancerous tumor, if it's a cancerous tumor, has legs to it. And we go in, and what we do is we take those legs, they're like roots, and that's because cancer has its own blood supply, its own food supply. It's like an island unto itself. So you want to increase your body's circulation, but what we're going to do is we're going to cut off the circulation to the tumor by going in and crippling the legs. We're going to pull the legs apart, and then we're going to go in with the Cellsonic so it hasn't got these feeders, and we're going to cripple its energy supply. Then we'll go in with the energy supply that is meant for you, the beautiful energy supply of the Cellsonic, and wait till you see the difference. And we've seen it where people have done fibroids, tumors, people that had to go for hip surgery using the Cellsonic, and then those who use the Wolf non-surgical first. and then the Cellsonic, and then we're going to go wham, bam, thank you, ma'am. Okay.
There you are.
Yeah.
No side effects.
No side effects. No side effects.
That's so important.
So what about, okay, so Sheila says, I've got 4 children and 3 of them are covered with eczema. And I understand that eczema it will turn into psoriasis. How do I work with this, and would the Cellsonic help my children?
It certainly will. So treat the areas which have the eczema on them and treat well around those areas. I sort of picture this as an iceberg. What you see above the water level is not the whole story. There's a lot more spreading out below the water level. It's the same with the skin. So treat the whole area. And a lot of it can be autoimmune, not just infection. And somehow that is sending again these messages to the brain and get everything sorted out. And she's saying with the children, and I in my teenage had loads of spots and things, which affects your personality. Those are the formative years. Do help the children in this. Don't just say, oh, you'll get out of it as you get older. No, because you're a bit ugly in those days, in the times when we wanted to talk to the girls, and it's not good for you. So do give them that help. What I found, and as I see happening with the youngsters nowadays, so many creams and chemicals to put on your skin. The skin can take all those rather dangerous chemicals in, and that's not recommended. So all your knowledge of the organic foods, that's important, Dr. Wolf. That will help. The Cellsonic will help.
Yes. So Blue D, that's her name. Anything for primary progressive multiple sclerosis. And if I can say something here. Oh, let me just backtrack for 1 second. Is that okay? So let's talk about eczema and psoriasis. So we use the Cellsonic, but guess what we do before the Cellsonic? What we actually do is we clap around the area. I've invented what's called a clapper, and you actually clap the tissue around the area. And could you ask them to bring up a clapper? I want to show people, because doing clapping is really an amazing thing. It's mind-blowing, actually. Go to my library and click on Clapping for Life, Clapping for Health. And I've got all the videos on how to do it. And don't you dare tell me that it doesn't work, because there's a clapper. Okay, and it took us about, believe it or not, 9 months to a year to invent it. It's all natural rubber, but it's the type of clapping that we can do. I clap myself every other day, and I do it for about an hour, different areas of the body. But what we do in eczema psoriasis, well, we clap everything from any type of joint problem, muscle problem, swelling, pain, you name it, stiffness. But with eczema and psoriasis, we'll clap around the area, then we'll actually clap on the eczema and the psoriasis and get it to even, are you ready for this? People are going to go, are you kidding? We'll get it to even bleed a little bit, or the pus to come out. Okay, then we spray it with infinite iodine, which is the only pure iodine on the planet. And we put a little bit of C60 coconut oil, which is, if you know about carbon 60, it's 250 times stronger in vitamin C, and it neutralizes free radicals better than anything else and heals skin conditions right up to cancer better than anything I've ever seen. And then what we do is we put that on, and then we use the Cellsonic around the area and on the area, and now we're talking about it. You will see a change within hours. Okay, because you've got almost every disease on this planet is leaky gut. And leaky gut is an autoimmune disease, which means attacking the body. But actually, we attacked ourselves first because we didn't know what to do, because they give us a rule book that doesn't work. And then we create these little pinholes, like I said, in your large intestine. Now you're just leaking crap throughout your body, and then it's going to come out your skin, because your skin is the mirror of the health of your large intestine. I hope you're getting this. This is why we always want to do daily cleansing tea and tummy love and black gold. Fix up your digestive tract, fix up your large intestine. But you use the Cellsonic on any type of skin condition and do what I just told you. Because when you take massive personal action in your life, there is no dis-ease. You will be at ease when you take your life back and stop poisoning yourself. Okay? All right, what were we talking about before I jump? Let me see here.
Oh, no.
Okay.
You were reading the question. I was following what you were saying, and then I
Oh, yes, I just read Blue. Anything for primary progressive multiple sclerosis. Let me just say, MS, everyone,
Yes.
starts in the large intestine again, and I can prove it, but understand this, that you have to go work on the areas of the body and the nervous system, but you've got to get that large intestine back in order. But I'll let Professor Andrew, take it away.
Yeah, and we got a very good report, and regrettably it was verbal. This guy never gives me anything in writing. And he treated the lady for multiple sclerosis. I said, where did you treat her? Well, on her legs, but on her head. Well, where on the head? In this area between the eyes and the ears. And so what happened? Well, he said she could move her legs then. And she hadn't done that for 6 years. Now, next time he came on, and he keeps calling me on Skype, about 2 weeks later, I said, just remind me, what happened to the lady with the multiple sclerosis? Oh, he says that she's all right. I watched her walking up and down the stairs. Now, that is a bit frustrating for me, because I want to have something a little bit more concrete to tell you about. But this guy doesn't make things up. And what he was saying when he said he was treating her in that area at the side of the head fitted with what I knew from what Professor Simon Shepherd was telling me in Bradford. And they'd done a lot of study on multiple sclerosis. That what's needed is a smooth blood flow across the brain. Now, in all our other organs, the blood is pulsed because of the heartbeat, but not across the brain. It's got to be smooth. And the smoothing of the flow is controlled by an outlet valve, and it's at the side. Now, I've forgotten whether it's this side or that side. And I think that this doctor I think he treated both, corrected the valve. It sounds like, in many cases, it's a mechanical fault. Now, there was a doctor in Italy, and he had a colleague in Glasgow in Scotland doing surgery on this little valve. But with a scalpel, things can be a bit tricky. Seems that the Cellsonic, as easily as that, corrected the fault, a mechanical fault. All good news.
Thank you. Okay. Dr. Lewis, I'm a naturopath, and I'd like to know more about the Cellsonic. Can you tell me how I can be trained? Well, sir, the best way to do it is to fly down to Ixtapa, Mexico, to the Ixtapa Palace World Training and Healing Center, and we will train you on how to use it. And yes, we also look after getting units for professionals all around the world. So please contact me, and you can see that information if you go to store.docofdetox.com, and then just click on EMF/energy, and you will find the Cellsonic information in there, and my extension's number 5. If you want to give me a call after the show, feel right ahead and go and do that. Oh, okay. All right. Now, Debbie's asking, how do I get treatment? Debbie, just grab a flight and come to Mexico, and I want everybody to understand, you do not have to be vaccinated. You do not need a PCR test to fly with Aero Mexico. You do not have to go in quarantine when you come to us. And when you go home, don't worry, we'll get you a spit test. You do not have to have a PCR test, so everybody needs to get this, okay? So understand, well, we've got you covered, all right? And when you come down, I guarantee that we will create the most healing environment you've ever had in your life. Between the Cellsonic, all the other energy medicine equipment, and what you're gonna drink, what you're gonna eat, and what you're going to hear. Okay, all right. Let me see. Dina, I started using the Ionic Calcium 3 days ago. All I can say is it's been life-changing. That's fabulous. And she's talking about the Ionic Calcium therapy we do. It's the only calcium product. And I'll tell you something, I don't mean to do a commercial here, but everybody needs to get this. It's all about frequency. And the Cellsonic has the most powerful healing frequencies in the world. And guess what? Our ion calcium is the only calcium that will actually pull all the calcium you've lost that's still in your body back in your bone. And what if you did both of those things? Wham! So that it's over. So understand something. We talked about how back in the 1900s, the early 1900s, you were stolen from this information. You're just a piece of physical matter that needs to be drugged down because you've got to get rid of your pain and your suffering because you don't know how to look after yourself. And then when it turns into beef jerky, then you got to have it cut out. And then you need to go and get implants put in because God doesn't know what he's doing. Seriously, or she, or he, or them. I'm not sure. But the conscious creator of everything made a body that will self-heal if you love and care for yourself properly. Let's move on. Jackie, a friend of mine has vasculitis, shut off her 2 kidneys, and she has dialysis twice a week. Would this help, Professor Andrew?
Yeah, this exactly is the case of that lady I met in Hyderabad, who'd been on dialysis 3 times a week. I think sometimes it goes on all day. Your life is totally disturbed. And with the Cellsonic, aiming at her kidneys, the kidneys are starting to work again. Tissue regeneration. Yes, it works. Very easy. No drugs. No drugs. Let's repeat that. You can do it.
Okay, if
it takes time. It takes time. You've got
Yes.
to, because the new tissues have to grow. It's not a one-off treatment. So if the lady can be treated every week until everything's working again.
So that means that you would have to come to Extapa Palace. You'd have to suffer it out in our structure water pools, which means the greatest healing pools that you can get in. And you'd have to just think about what you're putting in your mouth and what you're putting in your mind. And then we will do the Wolf non-surgical around the whole area, around your abdomen, around your pelvis, around your hips, your lower back, and around your kidneys to open up the fibers so there's no fists and they're not sticky glicky, because that's what we are. I hope you know that every place you have a disease, you've become a piece of beef jerky. Ever eat beef jerky? Well, that's what it became. So if we can open up the fibers, we can send in the frequencies, turn on the brain, turn on the right chemicals and hormones, and get the blood flow, the lymph flow in that area. Wham, bam. So when they tell you that there's nothing we can do for you, it's over. Just understand, that's called limited thinking. And that's what that is. And I challenge anyone that if you come to a dead end and you come to Extapa, that we are going to take you further and faster and show that you can be healed. And that's the God's truth. This is not about marketing. This is about human beings were promised a beautiful life. Where is it? Human beings were told that they were going to be taken care of. Where is it? I want to know where it is. Listen, from a limp to a cane to a walker to Depends to the nursing home. They've got a beautiful program all set out for you, okay, so that you can just go and this is your story. It is not your story, okay? So Andrew is 75. I'll be 65 next week. So understand something, everybody. He doesn't act like it. I don't act like it. It's all about frequency, and it's all about hooking yourself up to life, all right? And it's all about never being a victim again. Stop. You know, the biggest disease we got today is victimitis. I can't do anything about this. I can't do anything about this. All right? Let's stop hearing that.
Dr. Wolf, let me add to what you said there, because you said in that the doctors say there's nothing we can do for you. That's true. There's nothing they can do because they don't know. And the fact that they're in a big hospital and they're wearing a white coat and they've got a stethoscope around the neck is proof of nothing, that they've just been indoctrinated with what they've learned in their medical school. What I've discovered, and what you've discovered as well, works. Now, I've been going for many years at this, and I'm not living off thin air. We don't do trials. We sell machines to doctors who provide a treatment to patients who pay to be treated. And that is increasing. So we've got patients who know it works, who are telling their friends that it works. This isn't fiction. This is real. This is the new medicine. And you've got it there in Mexico. You're growing a huge campus with not just Cellsonic, all the ancillary, that's the right word, ancillary treatments which are compatible with it.
Yes.
This is what we.
Well, that's what it's all about.
Yeah, this is the new medicine.
We are the new medicine, and I'll tell you something right now. Within a year or two, we will be opening up other similar world training and healing centers around the world. There's 11 other actual resort spas that want us to come and do the same thing that we're doing in Extapa right now. Anyways, here's a good one from Grace. Okay, so how does this vibration not hurt, damage other sensitive tissues while you are indiscriminately trying to break apart a kidney stone? This makes no sense to me.
No, it won't make sense until you see it happen. Now, In fact, what she's saying about the kidney stone is not quite the same as all the other treatments I've been talking about. Now, in the kidney stone case, which involves a lithotripsy, that patient is anesthetized. So without the anesthetic, yes, it would hurt. Now, the Cellsonic is, in technological terms, in physics, is a lithotripsy, but it's smaller and weaker. And if it hurts the patient, then turn the energy down. There's nothing achieved in the treatments we offer where pain is required. Having said that, because the Dupuytren's contracture.
Yes, where the hand is getting this beef jerky scar tissue. And if I can say this before you say that, I want people to get what I'm talking about. So due to inflammation, decreased circulation, okay? And inflammation is where you have a fire in a certain part of your body. If I put a steak on the barbecue and I turn it on high, the steak will shrink and it will become tough. And it'll shrink. And that's what happens anywhere in the body where inflammation is caught, because the inflammation is there because of the infection, but the inflammation will actually dehydrate your ligaments, your tendons, and your muscles. So now what you've got is you've got a piece of beef jerky. And now if that's happening in the hand, your hand is going to start to close because of the tendons and ligaments are shortening. So go ahead. And now before I say this, I just want you to know that we have had many situations like this where we actually go in and we do the Wolf non-surgical is a technique that we use. You can go look at that on my website. If you go to Masterclass at the top of docofdetox.com, click on Masterclass, go to A to Z Wellness, okay? And then click on there. And if you use the word Wolf non-surgical with an E, I'll give you $1,000 course, and I will prove to you that we are right about this. By using Wolf non-surgical and the Cellsonic, you're going to see a complete reversal. But I'll let Dr. Andrew sir, go ahead.
The question was, why doesn't it hurt? Now, this is one case where it can hurt. Some people don't find the pain, but others do. So you're hitting into the palm of the hand, which is very sensitive. On the fingertips, we've got lots of nerves. We're very tactile. But interestingly, there are two types of pain. There's a pain which stops immediately, the impact stops. And there's another type of pain which can go on and on for hours until it dissipates. The Cellsonic, if it has caused the pain, stops. That pain stops immediately, the pulsing stops. And I've explained this to patients. They say, ouch, ooh, that hurts. So I explain it. And I say, well, look, we can get you a lignocaine anesthetic. Oh, no, don't bother. How long is this going to last? About a minute. Oh, we'll carry on then. And they grit their teeth and they tolerate it. Now, that's just one case. The rest of it, I would say, they can feel it. And it's tolerable. And then anything they could feel then stops. So generally, it's truthful to say it's not painful. So our little machine must not be confused with the big, powerful lithotripsy, where the patient is totally anesthetized.
Right. This is about working in harmony with your cells, not disharmony. We are not doing disharmony this is healthy decomposition. This is healthy.
Yeah, you can say that.
This is healthy taking it apart properly. Okay? Brenda, I'm just going to answer this because I like to answer everything. I know it's a little sidelining. Brenda, like to see more affordable for average person on ionic calcium therapy. It's amazing, but more affordable. Let me tell you, we have a 25% markup. I'm not shy about that, okay? And the reality is, it's very expensive to make. And understand something, everyone. I want to just say this: the ionic calcium therapy is the really only true calcium therapy in the world. No calcium supplements actually work, and I can prove that. And when people say they have ionic calcium, they don't have calciums of ion. There's only one product that has that, and that's what we have. Now, understand something right now. Think about this. That means that somebody invented a product that's invisible, that's stable enough to put into water, but unstable enough that when it goes into the body, carries on 120,000 different processes in your body and is capable of totally reversing osteoporosis to the point that you are breaking down and crumbling. Now go into PubMed.gov, and go in there and you'll see that you can date back 100 years where they talk about it would be amazing if we could ever invent a product that was the ions of calcium, because we could cure it all. And understand, that's why the ionic calcium can't be on my store. That's why you got to go into my library to go take a look at the ionic calcium guide. And you can look at cancer, you can look at diabetes, you could look at jaw problems, you could look at Alzheimer's, you could look at all of these things. We've got all the science, all the videos there, but the FDA will not. The FDA will not let me put it on my store where you can just purchase it. You got to call in to get it. So there's the situation. So I'm telling everybody here that understand this is not an easy product to make, and if you do your research, you'll find out that they actually say that it is scientifically impossible. The same thing that that the professor has, the Cellsonic, everybody would have said that was impossible years ago. You could never invent something like that because it wouldn't work. You would hurt the person. Well, that's not true. So understand, we only know what we know, and tomorrow it's a different thing. You know what they ever said was today's truth is tomorrow's lie? Well, you know what they say? This is as far as we can go. Well, let me tell you something. The potential of the human body and of real true science, quantum physics, we're just starting to stick our toe in.
Yeah, that's right.
Okay. Carrie, I need help with elevated calcium. Was told coming from parathyroid and to get removed. Do not do that. Let me, and then I'll let you take this over. I need to tell her this. Please do not. Please try my Infinite Iodine. It's 10,000 times smaller than Lugo's iodine or Nascent iodine, and it's the only non-toxic iodine in the world. And if you start using my Infinite Iodine, spraying it in the back of your throat, and you do 5 sprays, maybe once a day, and then do my Infinite Iodide, it goes straight into your parathyroid and thyroid to balance it out, okay? And then look at the ionic calcium. We're gonna nail this. You're gonna see a change within days to weeks, I promise. Now, Andrew, what would you like to say about her elevated calcium due to an imbalance of her parathyroid?
I've had inquiries about treating the thyroid, and people have done it, and as far as I can tell, because I don't always get feedback,
right,
everything's gone well.
Right.
Now, what you've just said, if that can be added to all my other Cellsonic users, then we'll get better results around the world, not just in what you're doing.
Andrew, I make you this promise between me and you as a friend right now, live online. What I've got and with the Cellsonic, when we put this all together, we are going to create a healing for the whole world.
That's right.
And just know this, everybody, I am not kidding about this. And remember something, I'm not some kind of doctor that's hiding out. Everything I do is based on science. I've got enough videos out there to educate you, and I give you enough education free that you need to find out if 1 and 1 are 11 or 1 and 1 or 2 or 11. The reality is this, the proof is in the pudding. And when we start, if you don't believe me, why don't you go look at my testimonials, everyone. These are real testimonials. We do not coach our people. When patients come, they want to give their testimonial because guess what? The world's suffering. We actually think that we have to suffer because the great scientists and the great doctors have done everything they can. No, they've been programmed like the rest of you. And the reality is you better open up your mind and you better open up your heart and start doing self-care and self-love, or you're never going to get what you want. And that is truly the bottom line. Okay, so I have Stephen here who says, I've had surgery a few times, and does it help with repair of the surgery? My surgeries don't seem to repair properly. And well, I'll tell you, there's too much inflammation in you, my friend. Your diet's not right, and you probably backed up your bowels into your liver. So I'd look at doing a proper colon cleansing and flushing out your liver with the ultimate coffee enema. Try to look at getting a perfect day consultation. But can you please talk about, they want to know, when it comes to surgery, how will this help after the surgery for repair? Organs, tissue.
Help. The Cellsonic helps enormously. What we don't know, but I can suspect that Steve also has got internal wounds caused by the surgery.
Yes.
And sometimes these are called adhesions.
Scar tissue.
One organ internal scar tissue. So one organ has been cut and its adjacent organ has been cut, and these two then stick together, and that's a big problem. Now, Cellsonic can be used before, during, or after surgery. Now that sounds odd. So if a surgeon is preparing the patient, do the treatment before he cuts open the patient. In fact, let's go back a step. Does he really have to cut open the patient? Isn't there something that Cellsonic could do so that we avoid the surgery? But let's leave that to one point, to one side. Maybe there is a reason, I'll think of a good one, why he has to cut open the patient. So start the healing process before you do the cutting. You could then, if you've forgotten to do the treatment first and you've got the patient open, you could still do some Cellsonic treatment. And if you've still forgotten to do it and you stitch the person up and you say, right, give them a load of antibiotics in case there's any infection. And somebody reminds you, you should cut down on the number of antibiotics you're giving these people because they become resistant to it. So don't give the antibiotics. Do the Cellsonic. That kills the infection. And it will penetrate deep down to where any little germs may have gone. There's a very good paper we've done on how to treat a wound, treat external wounds and internal wounds the same. They're just wounds. And the Cellsonic penetration will heal those wounds. I've got one patient here in England who's seeking some advice because I think even 40 years ago, she was kicked by a horse in her stomach. And that's caused injuries which weren't properly dealt with in the surgery that was following the kicking. A kick from a horse can be lethal. So there are some adhesions there. Now, she needs, I think, cutting open again and probably a mesh putting between these two bits that are joined together at the moment. And then the Cellsonic can be used to cause the healing with the mesh in between. Now that could work, and this could be keyhole surgery. It doesn't need to be a massive job. But if the surgeon hasn't got a Cellsonic, he's hoping, fingers crossed, that the healing will take place. And the antibiotics. Antibacterial resistance is one of the major plagues at the moment going around the world, especially the rich world. We can solve that.
Very good. Now, if I can backtrack a little bit, first of all, some of the worst adhesions, the worst adhesions are caused by surgery, and surgery causes more scar tissue than anything else that you can do in your life. That's it. So most people have to go back and do more surgery. You'll find that the fibroids, the tumors are all in that area. So let's take a look at a woman with a cesarean or anybody who had a surgery. I promise you, and I make this a promise, that within a half an hour to 40 minutes, we will have 50 to 80% of that problem resolved already. When you do Wolf non-surgical, we actually pull the scar tissue apart to beef jerky, and then when we go in with the Cellsonic, it's over. I don't care. I really don't care. I care about you, but I don't care how much you've suffered, how much you've been around people, and they've said, I can't do this, there's nothing we can do, there's nothing we can do, there's nothing we can do. That ends here, and I totally mean that. This is not arrogance. We've done it so often. So understand, surgery causes more scar tissue than anything else. Women with cesareans, okay, let me tell you something. They can't digest their food. They can't poop right. Okay? They feel restricted as if somebody tied knots in them. They feel pain all the time. They can't make love properly. They get bladder infections all the time. They get fibroids growing. They get cysts growing in their pelvis. All of this happens. You strangulate the bowel, you die. Did you get that? You die. The way you poop and the way you pee will tell you how you live. And that's very important. Now, the other thing that Andrew said, and Professor Andrew said, and I just want to kind of tweak it a little bit, please. That's all. Do not get mesh. Go to a surgeon who's going to do suture. We only did suture 10 years ago, 15 years ago. And understand, I've got people that they will fly even to another state or another province to get suture. You get mesh and you put a foreign object in there, I guarantee that you are going to have problems. That mesh could cause even brain problems. Did you get what I said? And it could be down in your pelvis. Do you want ovarian problems? You want cysts? You want all this stuff? You do not put a foreign object in your body. You do not put something alien in your body. Did you ever have a sliver? How does that feel? But guess what? You don't know what's going on down there. You put mesh down there, and that's like putting that steel cables or steel row bar into cement. You try to get it out, and it's going to bother you. So you find a doctor that's going to use suture, which will dissolve, and guess what? Now you're going to have a healing. So let's do it all right. No mesh, because you're going to be in a big mess if you do mesh. And it's going to rip again. If you don't change your diet and bring up your vibration, the way you live, you're going to rip out just beside the mesh because it's a physical block and a dam, and that's a damn mess because now the blood can't flow, the lymph can't flow, the energy can't flow. You're going to weaken the area. So where the mesh is, it's going to be cemented, but beside it, you've got a block, and whenever you have a block, well, how does a beaver dam? What does it do? Slow down the flow in the river? Don't give yourself a beaver dam. And understand, it costs $15 to make the mesh, and they charge $2,500 for the mesh. Don't do it. Suture. Think about it. Okay, so what about burns? Kim says that she's had some really bad burns. How does it help with burns?
Greatly. Of all the types of wounds, the ones that respond best of all are burns. To the extent that after a burn, there can almost be no scar showing. So burns are very responsive to the Cellsonic treatment.
Very good. Okay, so nerve pain. What about nerve pain? Stephen says, I've got nerve pain, I've got sciatica pain, I've got pain in my neck, nerve pain.
It's probably one of the greatest treatments used by Cellsonic. Where it hurts, aim at where it hurts, and the patient feels better. It's as simple as that. And we don't do a lot of thinking about it. What the Cellsonic's doing is going to the cause of the pain. It's not masking pain. This is one of the big complaints about the pharmaceutical system. People have got we'll take this, and then you don't feel it. But you haven't solved the basic problem. The Cellsonic will solve that problem. New nerves can grow. I told you about the patient who got severed spinal cord.
No, you didn't. Can you do that? You told them, everybody, if you want to go see the interview that I did with the professor yesterday, please go to my energy medicine guide in my library, or you can go to Telegram, or you can go up into YouTube, okay? And you can see that. And can you guys put the link up, please, where they can find the interview if they haven't seen it? And if you don't mind, I'd like to say something before you go any further about the paralysis. No, it's not a supplement. Can we put a picture up?
I'll add you the link. Yeah.
Can we? I want the picture up, guys. So I want the picture just to come up maybe every 5-10 minutes so people can see it. It's a device, okay? And this device weighs a little bit, doesn't it? How much does it weigh, Andrew?
40 kilos.
That's right.
You'll struggle to lift it on your own.
Yes.
If you're going to lift the machine, 2 people should lift it.
Yeah, and people are asking what the price of it. Well, you're looking at, by the time you get it, around $75,000, $85,000. Okay.
Yeah.
Yes. Go ahead about the paralysis. But guys, can we please show the picture of the unit every once in a while? Just bring it up.
Yeah.
And bring up the link for his interview, because I have people continually asking me here, where's the interview? I've been trying to find it.
It's on the Facebook page yesterday.
Yeah, but they say they can't find it on their feed.
Oh, okay, well, okay.
All right, so I need to have it like, so go to, this is the best place to go, is to the library. You go to docofdetox.com, go to the top, click on library, go in, go to the energy medicine guide, and then you're going to see the greatest energy medicine breakthrough, Cellsonic. And you can watch the interview, and then we'll have the actual Q&A. Both of those will be in my library. So that's where you're really going to get it and find it easiest, okay? And then you can go in there and dive in and go watch the How to Become #1 at the Art of #2. And I have so many other, Medical Mafia, Okay, so Medical Mafia is in there. Go take a look at the whole history of how you were robbed of your health. And it's a short video, but it's truthful. Want to talk about the paralysis, Andrew?
This was a most amazing case for me. The doctor was Dr. Ramesh Chauhan. Place was Hyderabad in India, one of the world's biggest cities, double the population of Switzerland. And the girl was 18. 4 years earlier, she'd been in a car crash, either in the car or hit by the car, I'm not sure. But the result was that she lost all control of her body below the waist. And unfortunately, I think her family was able to afford to provide her with a car and a driver so she could keep her education going. And when I saw her, she'd still got calipers on her legs, but she could wiggle her toes. And she had a smartphone, and she spoke good English. And she showed me a video of her in the swimming bath, and just going from corner to corner in the swimming bath, moving her legs up and down. And I could see that this movement, this control had been restored. So I said to her, can you tell when you need to go to the toilet? And she beamed, because she knew I understood her biggest problem. She'd lost all dignity. Now, the control was coming back. The nerves were regrowing. Messages were going to the brain. The brain was receiving signals. It's time to go to the toilet. And with a stick, because remember, she still hadn't yet made these muscles that hadn't moved for 4 years in her legs were having to grow. So it's not just the nerves. Everything else has to improve as well. The protocol that Dr. Chauhan had used was he treated both legs from the ankles up to the hips, across the hips and the whole spine. And that restored the nerves. No drugs at all. Her nerves were regrowing. And that was, you had a very famous actor who played Superman, and he came off a horse, and I think he landed flat on his back and smashed his spine. I think what he'd got, the Cellsonic would have worked on him. There's no other way. Surgery can't do it. Nerve ends. You can't join nerve ends together like wires with solder.
Okay, thank you. So can I just go to the side here? I like to deal with everything that comes up because people will put all kinds of things up on Facebook. Mary says, yes, it would be nice if they were just up front with the cost of this so people can plan or budget for it. Now, Mary, we're always up front. There's nothing, we don't hide things. This is not some kind of game. I want to make that perfectly clear to people. I give you my extension. It's number 5. You can call me with all your questions. You can challenge me, okay, on anything that you want. Let's make that perfectly clear. All right? Don't look at me as some kind of marketeer. And if you do, then I would tell you to walk away right now. If you do not feel you can trust me, walk away. Let me put this perfectly clear. We cannot put the prices of ionic calcium ion therapy up on our website. We are told by the FDA if we do, they will pull our website down and I will be shut down forever. So we have to put the information into the library on our ionic calcium, okay? And that's in the ionic calcium guide. We're not allowed to put the prices up. We're not allowed to show the product. So when you go to ionic calcium at our store, store.docofdetox.com, we can talk about it. We're not allowed to show the product. We're not allowed to put the price up. So that's why we tell you that you need to call us. And yes, it is expensive. Merigen is $450 a bottle. But nobody else seems to have invented something that can totally turn osteoporosis around and almost all other autoimmune diseases. So then we've got Dentagen, which is cheaper for the jaw. We've got Megagen, which is like around $200, okay, per bottle. I don't have all the prices. I don't deal with that. But you can call my office anytime. Let me make this perfectly clear, Mary, and I know that you are not meaning anything, but guess what? If you think I'm a scoundrel, or if you think we're trying to rip people off, good luck with that. Money from me, okay, that was over a long time ago. Let me make this perfectly clear. I know this is your show, Andrew. Let me tell you something. I was worth $3.5 million 10 years ago. All right? No, 14 years ago. Okay? 9 years ago, I was worth $2,200. I lost it all. And what did I did? I found myself. And I found out we're all family. We're all spirit. So you can take it or leave it. But the reality is everything I do is the passion and the love for myself and for others. And it has to be that way. If we don't have integrity now in these times, then we've lost ourselves. The only place that I can grow and expand is consciously and super consciously. I can't expand any other way. And let me make this perfectly clear too. With the Cellsonic for a treatment around the world, it's around $1,000 US. Okay? At the Ixtapa Palace, we will be charging $500 a treatment. And if you think that this equipment is cheap, understand something right now. Just one shock head to work with you, okay, is going to cost me to get it $1,400. One shock head is only going to last a few days. So I want everybody to understand something. I will divulge everything. There is nothing I'm going to hide. So, and if you want to call any of my staff, you want to call me, you need to understand something. If we're not in this together, but don't try to make me out to be something that I'm not. I see it right here on my Facebook feed. And, oh yeah, we need to talk privately, blah, 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 to other people. Seriously? Okay, seriously? Okay, let's get back to the show. But I just want to know, I want you to know something. I don't leave this stuff, okay? I turn over everything. People are not going to be able to try to pretend I'm something that I'm not. You don't even know me, Mary. Thank you. So understand, I don't need people's business if they think I'm doing funny business. Only come to me if you want to take massive action. If you don't trust someone, stay away from them. That's what I would do. All right, so we talked about, let me see here. Let me see what else we got here. So once you, okay, this is Sue. So once you had the initial treatments, do you need to do them over and over? As you are in Mexico, how would, okay, so you can just answer that. Would you?
Well, of course, it depends what's being treated. And if it's a tennis elbow, calcified shoulder, one treatment. And that is remarkable because there are other machines that have evolved from lithotriptans, but they've taken a different path in terms of the technology. And they need 5 or 6 treatments to get to where we can go in one treatment. Now, if it's a diabetic ulcer, and it's a big ulcer, that should be treated. You could treat it once, but it heals better if you treat it twice a week until it's fully closed. And a big wound could take a year. Now, as you say, you are
Andrew, it won't take a year. You're talking about just Cellsonic. I want everybody to understand. We can cut that down to weeks or a couple of months. So understand, what's your life worth, everybody? Is your life not worth going to someplace beautiful and be treated with love and respect, okay? And go in and swim in structured water, which is the most healing water. Swim in the ocean, get natural iodine coming off the ocean. Only eat pure high vibrational foods. Only take the best C60 in the world. Only do ionic calcium and do things like the best humic fulvic. Make sure that you're doing ultimate coffee enema. Look, let me tell you something. Andrew invented something that is totally amazing that nobody thought would ever be invented. I get it. But I've taken things that people thought could never be invented and brought them in together. And understand, when you come to us, listen to me. Your lifestyle caused your disease. You, on an unconscious, subconscious level, you didn't do it on purpose. But the reality, what happens if you were to come and stay with us for a few weeks or a couple of months? I'm going to tell you something. You're going home a different person, because until you change your personality, you're not going to change the reality of your disease. You have your disease because of the type of emotions you have, the things you eat, the things you drink, the way you think, the way you act. All of this. We're talking about bringing everything, the best of the best, together. So the reality is guess what? Do you know when people can look after themselves? When they're dying. When there's no hope. Guess what everybody says? Not everybody, a lot of people. I don't have the money and I don't have the time. I don't have the money, I don't have the time. And guess what? And then when they're on the edge and then they can't be helped anymore and they've done the whole medical route, all of a sudden they find the money and the time. Isn't that kind of funny? And the reality is it would be great if I could just do everything for free. But the reality is this. I am not allowed to reduce my ionic calcium prices. If I do that online, I lose it and I can't sell it to anyone. Andrew did not tell me that I couldn't go half price for my patients, and I am. So understand something. Let me make this perfectly clear. When you have created the perfect day from the minute you wake up until you go to bed on an emotional and physical level, this illness is never coming back, so you don't have to come back to me. The only reason why it would come back is because you decided that you weren't going to change parts of your personality that weren't you. Because you would never have dysfunctional parts of your personality if you were conscious enough to know that you were hurting yourself. And that's my job, and I will not fail at that. Thank you, Andrew.
The question was how many treatments are needed. Now, what we're very proud of at Cellsonic is the cost. And people ask me, what does the machine cost? What does a shop cost? And so on. I said, look, those costs are not relevant. There's only one cost that matters. Only one cost that matters in medicine, the cost of a cure. And we have the lowest cost of cure for whatever it is that you're treating, be it a cancer, a wound, a broken bone, or whatever. Any other way of trying to heal that or cure that is going to cost more if it works at all. So it's not just the time and the number of treatments. It's, will it work? Yes. Is it safe? Yes. And will it cost less than any other way? Yes. That's what we offer.
Thank you. Denise, I have interstitial cystitis, a so-called incurable disorder of the bladder. First of all, it's not incurable. First of all, on a level that you need to know is if you get a consultation from one of my consultants, my master consultants, I'll give you a money-back guarantee. It costs you $150 an hour consult. We'll go on Skype, Facebook, WhatsApp, regular phone, Zoom. What do you like? And then what we'll do is we will, for that $150, give you a lifetime that you can call us as much as you want about anything, because we need to learn the language of self-care, the language of healthcare, the language of self-love. That's it. You got to learn that. You got to learn that. And the reality is I offer you a money-back guarantee on this, and you're going to get a 300-page manual that will help you to assess your skin, your eyes, your bowel movements, and everything else. And it'll tell you where you're going, what you're doing, why you're off track. But first of all, what is it? You know what that is? That's a chronic bladder infection. You can't have a chronic bladder infection unless you're pooping in your pelvis. So don't tell me you don't have bowel problems, because you do. Because how would you ever get an infection in your bladder? Well, that means you're absorbing the waste from you're absorbing the waste into your bloodstream. That goes through your liver, through your system, and it's got to come through your kidneys. Your kidney is a sac. Your bladder is a sac that sits right in front of the last 4 inches of your large intestine, and most people are constipated. That's why they grunt, gotta get it out. Okay? That's why they do that. And when you have waste sitting in you, you reabsorb it. And where is it? Right in the last part of your bowel. Do you think that the physical pressure and the chemical pressure isn't bothering your bladder, and the waste that you're absorbing into your pelvis isn't attacking it when your pelvis is called the pelvic bowl and you're filling up with infection? So that's what cystitis is. It just means inflammation of the bladder from infection. Okay, so that's easy to look after. Go to How to Become Number 1 at the Art of Number 2 in my library and watch that 6-hour masterclass, and it'll blast you away. You'll go, oh my gosh, he's absolutely right, because 1 and 1 are 2. But let's talk to Andrew about cystitis.
Yeah, it's the same as that earlier question on vaginitis. All of that area is prone to getting infections. And the Cellsonic treatment can be aimed at that area from all directions very easily. It kills the infection. It's that easy.
Okay, Deborah, can this therapy help someone that has to use CPAP? I quit breathing 100 times an hour. Wonder if Cellsonic, give me 1 second, therapy would help.
There's an abbreviation there. What is it?
Pardon? I don't know what that
What-
is. I've never heard of that before. And I want to say something right now, everybody, and you need to get this. People will call me up with a brand new disease or on a brand new drug. I'm not going to try to keep up with the new diseases and the new drugs, and nobody can. And understand something. Did you ever notice that you can't even pronounce the drug names? And did you ever notice something? Fibromyalgia just means pain in the muscles. Colitis means just inflammation in the colon. Did you ever notice that it's all in Greek? Well, guess what? That's because they want you to feel like you're stupid in the rest of the world. But we're not stupid. All of this stuff, it all originates from the same place, okay? Misinformation, constipation, inflammation, scar tissue formation, calcification of our muscles and bones and joints, and then mutation. I don't know what that is. Can you look that up for me, Drake? What is
What I think the question was about is what we call palpitation. So breathing is not regular.
That's right. No, but
And
I need.
that-
Can you see what CPAP is? Please look it up. Thank you.
Oh,
But
CPAP,
that sounds
like,
to me more of a
CPAP
mind
breathing.
problem.
Oh,
than a lung
CPAP.
problem.
CPAP. Okay, so she's got CPAP to help her breathe. That's it. Sorry. Yeah, CPAP. It's a breathing device to help her breathe. To help her breathe. Okay. So the problem is
the
that
problem-
she's got inflammation and infection and mucus congestion, and her lungs are filling up with mucus. Your lungs will not fill up with mucus unless you have infection and inflammation. First, you get inflammation. When you have chronic inflammation, the cells say, look, we can't be inflamed all the time, because if you do, you're burning the lining. So the body goes, make lots of mucus, make lots of mucus. So then it gets out of control, makes lots of mucus. So now the alveoli in your lungs are filling up with mucus, bad bacteria, and now you're choking. There you go.
Yeah, the Cellsonic will loosen that up. And it was like an earlier question where there was infection in the lungs. Even think of coal miners with all the coal dust down in the lungs. You've got to get it out. And the Cellsonic will break up that dirt and mucus that's sitting there. And it will have to be coughed up. How to stay well? Exercise a lot. Use the lungs. Use the heart. They're fundamental. A lot of breathing in and out. And you've got to go for a walk. You've got to go for a run. And yes, you've got to spit it out. Now, that might not be very
Pleasing.
very gentle, very polite, but it has to happen. It's got to come out through your mouth.
Okay, now I'd like to tell everybody something. And this is the deal. So, if you notice, what we try to do, we have a do-it-yourself guide. We have the clapping for health. We have exercises that you can do. So much that you can do. We have one-shot therapy. All of these things you can do on your own. They cost you nothing. Sometimes you're going to have to spend money, everybody. Sometimes you're going to have to be worth it, too. But here's the deal. Get yourself a clapper, okay? And then go into my Clapping for Health, Clapping for Life guide. And then go take a look. Clapping your lungs and heart for health. Go read it and go do the video. And unless you've done that, then please don't complain and don't explain. And I mean it. You need to take personal action in your life. Now, go watch the video. If you want to use your hand, just use your hand, but it can get tiring. Where the clapper, it does a lot of the work for you. When you clap, if you find any bruising on the body, it's because you're overripe. That means that you have tissue rot. Okay? I hope you're understanding what I'm saying. Nobody bruises when they're healthy. And people that are dying will bruise without touching anything. They're rotting. They're tissue rotting. What do you think every disease is? Every disease we have, okay, is infection and it's tissue rotting. So if you have cystitis long enough, you have anything anywhere, the tissue's rotting. So let's just get that. So you should be able to clap if you're healthy. No matter how hard you clap, you will get red, but that's increased circulation. When you like some of that, you don't have pain, stiffness, swelling, inflammation anywhere except when you have a block. So what does clapping do? It gets rid of the blocks, it opens up the meridians, opens up your circulation. Now, if you were to do the clapping your lungs and heart for health, and you were to learn how to clap here, okay, and you were to do infinite iodine, and you were to nebulize it. I don't have the nebulizer here, I don't think. Yes, I do. Drake, do you want to walk around me, please, and get it? I want to show everybody this. I hope you don't mind, Andrew, but you know, the reality is I want to show people that I'm a multi-pronged person. So the reality is, if you say you can't afford our therapies, then why don't you just take everything free that I offer and call it a day? Okay, that's it right there. So I can't control pricing, but understand, when things cost things, it's because they've been worth it. Now, this is a nebulizer, and all you got to do is put the infinite iodine in its 1 part iodine, 3 parts structured water. You hit the nebulizer, turn it on, and you'll see a vapor come out. Breathe that in, and well, you know what that does? It disinfects the lungs. Now, it's not our fault, but we've dealt with lung cancer patients, COPD, we've dealt asthma, everything, and we've seen, by utilizing what we do, a complete turnaround. So anybody can you afford $20 for 1 ounce of infinite iodine? Start there. Can you afford $25 for a rubber clapper? Okay, so that's the reality. So we're talking $45. Get started and find out if we're just trying to take your money. Okay, I've just had so many people, Andrew, come on Facebook in this last hour. Okay, and it's just like an epidemic, right? So the whole world right now, and God love them, doesn't trust anyone. And why should they? We have lost complete trust in each other. Okay, and I get it. I understand why. Because nothing's true anymore. What we think is true isn't true. And you have to search so hard to find truth. Who's really caring? Who's really loving us? Who's taking us? Oh, it must be Dr. Wolf. Yeah. Anytime you want to come on my show and challenge me, anybody that's been on here bantering, please, just call my number and we'll do it, won't we, guys? We'll welcome you on the show. All right. So here's one thing, and I do not want information on my website, I mean on Facebook spread that's not true either. This is what Garrett says. Fungus disappears with water and baking soda in 1 hour. That's not true, Garrett. It wasn't fungus. Because the fungus is actually being leaked out from the large intestine into the bloodstream. And the person, if you knew about fungus, it's one of the heaviest particles in the human body. So it settles to the bottom and to the bottom of the body into the toes. And it's in their blood, it's in their tissues. It's not on the surface. And yes, baking soda is great, but I've never heard of that in my life, and I know it's not true. Okay, let me see here. What can a person do with plantar's warts or children's feet? Lots of warts under the toes and feet. Denise.
Yes, the Cellsonic works on it. And I know it. We treated my daughter that way.
Very good.
No problem.
Well, I know that because guess what? You will not have any dis-ease if you have the vibration, the frequency that the body needs to actually keep the cells functioning properly. And that's what Cellsonic does. Will there be Cellsonic at your clinic in Kelowna? Everybody, I need you to understand something. I've opened up a really beautiful fulfillment center that will fulfill everybody's needs in Kelowna, British Columbia, in Canada. And we will be able to send products to everywhere quickly throughout Canada. I'm not going to desert people. And we also are going to be shipping products all over the world from Canada because it's cheaper than shipping from the States. I also have 3 fulfillment centers in the States. And no, I am not going to have Cellsonic here because I need it under my supervision. And the other thing is that, you know, if you translate it into Canadian, we are talking about $115,000. And the reality is that we know that we're going to need a second one down in Ixtapa. And the reality is this. You don't want to know something? When are you going to be worth it? When are you going to be worth a plane trip? What are you going to be worth? And the reality is this. You know what? I like the idea of Ixtapa because when you come there, you're going to say, I'm not going to leave right away, which means you're going to be there long enough that we can change the programs in your mind so that you learn how to self-care and self-love yourself. Wouldn't that be great? Wouldn't it be great to come back a different person, to have a personality that creates a reality that you do matter, that you will question authority, that you will make higher vibrational choices on what you think, drink, and eat? And that's the God's truth. So you know what I want down there? I want people that actually know that they have value and their worth. You know, I had a lady here, and she came in with 2 of her children, and she's single, and we'll do whatever we can to help someone. So what is she doing right now? Okay, she says, I'm going to figure out how to get down there because she has a very sick child. And she says, we're coming down for 3 months. She goes, there's nothing better to do. Probably, and she also said this, and she's probably right. She said, Dr. Wolf, I think you're right that Halloween's going to be more of a trick than a treat, and they're going to shut us down with COVID for the whole bloody year, right until next spring. So I might as well be somewhere where my kids can play and get healed. And I said, absolutely, sweetheart. And we will do everything we can to make it as reasonable as possible. And I mean that. So the reality is guess what? It's not your fault. But if you have no value, and you know what people always say? Well, what if you're poor? Well, I'm poverty. You know what? Why don't you change your thoughts a little bit? Why don't you find your passion and your purpose and then gift the world with that passion and purpose that you have, and then you'll have more value. That's it. So let's love ourselves, bring our vibration up. You do know that people that believe that poverty is all there is are people that mostly have been raised in a impoverished family. And understand something, in this country of ours, and in most countries, there are countries that you're never going to get out of the hole. But in these countries, open up your mind, expand your intelligence, please, okay? And start talking a different story. Did you ever notice that people who talk about being depressed are always depressed? Did you ever notice that people, when they talk about joy and happiness, they actually are that? Did you ever notice that people that are sick are telling their sick story all the time? I don't blame them. I don't blame them because they've been in there so long that story is the only story they can tell because they feel like they're in hell. But unless you're going to shut your mouth and change the story, it'll never change. Because the image you have of yourself and the world and everyone else is exactly what your life looks like right now. And I am right about that. I might be wrong about other things, and I don't know you, but I do know that frequency matters, and what you think and what you say and what you do creates you. Okay. Let me take a look here. I've got a couple more questions. You know what I do notice though, Andrew, and is people are losing it. They're very short-fused, and they're attacking a lot easier right now. People have had enough. But understand something. Watch out that you're not attacking yourself. Watch out that you're not getting too angry, too depressed. I wouldn't go there either. Let me tell you something. That's why I teach about Braveheart. If you need to roar, roar. But then bring yourself back to calm, bring yourself back to breathing, or why don't you just go and blow yourself up, okay? See, I can't stop people from doing it. So if you want to scream and holler, have tantrums, get depressed, it's the end of the world. It will be the end of the world for you. And they know that, and they programmed us for this. That's why it's called the harvest right now. All right. There you go. I have, from my knee down, painful muscles, fibrosis, neuralgia pain. It keeps me up all night. Please give me some answers, Professor Andrew. Well, guess what?
The treatment is not just from the knee downwards. The treatment should be from the hips down to the toes. The nerves need repairing. You've got 3 components in the body: the nerves, the veins, and the arteries. And those 3 are always together. And if one doesn't work, the other 2 don't work. And something's wrong in those legs, but that can be repaired. The Cellsonic can do it. We've talked about nerve repair. It can open up the blood flow. So from the hips on both legs down to the toes, front and back. And that's quite a lot of shocks because it's a big area. And very likely one treatment will sort it out. If it's still not quite settled after 3 or 4 days, give another treatment. So that a person with that problem attending your new place in Mexico can be sorted out whilst they're there.
Oh, Andrew.
Quite confident of that.
You know what? Everybody go take a look at Wolf Non-Surgical. It's the most powerful body work in the world. Go do everything else. Chiropractic, massage therapy, acupuncture, they're all great therapies. But unless you're working on pulling the scar tissue apart that's sticking together or knotting up, then you're not doing anything, as far as I'm concerned. It's all about circulation. And Andrew, what we would be doing first is we would actually go in and open up the hips. We'd open up the spinal column because that's where all the energy flows. Okay? And then we would open up the pelvis because that's the holy grail of hormones and chemicals down there. And then we would go and work in the knees, and we'd work in the ankles, right? And then we would work somewhat on the muscles of the bottom of the leg. Then we would do the Cellsonic, and it's over. After this, and when the Cellsonic is done, we'd also be using Pain Away essential oil and also DMSO to keep the circulation up so the frequency does its job. So we have a whole protocol for that. Okay?
Yeah.
Yeah. So,
Yeah.
you know, what Andrew's telling you is what his therapy does, and he knows it does that. But now I'm going to be sticking in many prongs to make sure that we win this thing. You don't go giving money back guarantees for consultations and treatments and think you're going to stay open if you've got a weak therapy. Okay? Can you talk about the difference between this and PMF? This is from Jackie. PMF is great, Jackie, but it's slow. When you start utilizing Cellsonic, okay, and a proper lifestyle, diet, exercise, okay, and Wolf non-surgical, we're going to knock this out of the park. Also, when people come down, they'll be doing the pelvic expander. They'll also be doing pelvic squats. They'll also be doing, if we can get them to do it, the ultimate coffee enema. And understand, everybody that comes down to Mexico to Ixtapa Palace, we do a consultation on everyone before they come. Now, most people will call and then it'll take them 2 weeks to a month to come. They usually don't come right away. And the reality is why do we do that? Because we get you started on the perfect day diet. We talk about your emotions, talk about your diet, talk about exercise, talk about nutrition. And then you go and you order your products if you want. If you don't want to order any, don't. And then what you do is you bring them with you, because we will not sell them in Mexico because there's another 18% surcharge that we can't stop. So the reality is we're not going to sell products in Mexico, so you can come down without them or you can come down with them. But we do a consultation on everybody before they come. All right? And then if the person comes, we deduct the $150 off of the rest of the therapy, because that is something that we need to do for everyone. And if the person doesn't come, then they paid $150. But what they got was they got the lifestyle guide and they got all the support that they needed. Okay, so PEMF. So we know that most PEMF, okay, it increases the circulation around 32%, which is really great. But the reality is we're talking about the difference between, and it's not water, but a cup of water to a bucket. Cellsonic's like a bucket. Cellsonic has the power to go in with these frequencies, and it's like this. It can get the cork out of the wine bottle. It can get rid of the dams and the blockages, and it can just say to the brain and to the mitochondria, wake up. We're back. What do you think, Andrew?
Yeah, it's pulsed electromagnetic field, I think.
Yes.
And it works, and it's likely a product we could even put on the market. And it's something people can use by themselves at home. I mean, this isn't the $75,000 product. It's probably $2,000 or $3,000.
No, it's actually,
so it's something people.
It's actually around $8,000. It's around $6,000 to $8,000. They're not that cheap. They're not that cheap.
All right.
Okay.
Well, we have talked about it because there is a demand for people to have something they can use at home. And from what I can tell, almost to wear the machine, it takes time. As you say, it's slow. The difference with Cellsonic is that it's something you can do at a clinic with all the additional treatments mixed in as well.
That's right.
And then the mentality, the mind, which is what governs everything. Because if that's not right, no amount of treatments are going to really solve it permanently. So yes, it's a useful contribution, but it's not the answer. If we could make anything else that worked better, we'd make it. And my advice to Sanjeev, Dr. Gati, who is behind the machine, is don't change anything. That machine is working. We've no plans to change it at all.
Thank you. Denise, I would like to know how I can recover after being in the hospital for a bowel block. I am exhausted and had several CT scans, X-rays, and barium. Can I answer this first? Is it okay, Andrew?
Yeah, you go.
Okay,
Yeah,
so
go.
first of all, I just want to tell you something. Denise, this is a problem that most people have. And again, remember when Professor Andrew was talking about adhesions? Well, you actually created adhesions from an inflammatory diet and from a slow transit time of fecal waste. So it creates infection, inflammation, or maybe you had surgery prior to this. And we already told you that surgery causes more scar tissue than anything else. Anybody out there that gets surgery and doesn't get Wolf non-surgical, that will be, okay, your Achilles heel. That will get you the cane, the walker, the Depends, and put you in a nursing home when you're older. Do you ever hear people say, oh, well, I've got this sports injury from time when I used to play football, or I got this from this, and it's like 30 years ago. That's how terrible our healthcare is, because they don't even look at scar tissue. Did you know that medical system looks at scar tissue only when it's a tumor, or if they're going to cut your hip out, or cut some part of your body out to replace it with something? And then the natural health industry doesn't even look at it. Tell me that chiropractors work with scar tissue. Acupuncturists. I have a doctorate in acupuncture. That doesn't work with scar tissue. Can't even get by it. Okay, tell me that massage therapists work with it. No, they don't. They don't work with it because you got to know how to pull these fibers together. They're stuck together like glue. So what we've got is we've got adhesions in there. The adhesions cause the bowel block. So now you can't poop properly. So now you get fecal matter dried like a dried old cork in you, and that'll kill you. So even if you get your bowel unblocked, love, you still got to get the scar tissue out. So what I will tell you, please give me a call, and I mean this because this is life-threatening. Give me a call because it's going to happen again. Because the scar tissue has to be removed, and nothing works better than knowing how to create the perfect day on a diet and emotional level, and then doing things like clapping, pelvic expansion, our pelvic squats. I'm not kidding about this. Doing belly button therapy that releases, it's go check out belly button therapy, please. Go to my do-it-yourself guide and watch these things. Most of these things are free. And then belly button therapy will release 70% of your serotonin, 50% of your dopamine, and millions of endorphins. It releases more hormones to lengthen, strengthen, and relax your muscle tissues in your body that are constricted. Okay, and it calms you right down. But the reality is what we need to do is we need to go in there with I'll tell you right now, and I make this promise. I don't even know where she lives, so I will do this on air for free. We will do the Wolf non-surgical, and we will do the Cellsonic, and and the whole thing will take no more than 1 hour, and we'll reverse it. In 1 hour, we'll reverse it. Did you get that? People are dying every day. People are suffering every day because of these blocks, because of the scar tissue, displaced calcium, and nobody knows what to do. We're a ship of fools here. Okay? And understand, anything that's been approved by the government, and any school that you've went, the longer and stronger you went to that school that's been government approved, the more screwed up you are. And that's the deal. Because it's a government with inside of a government. And you know what? I'm not putting anybody down. I'm just saying, when you're tired of going the regular route, come to us, and I'll put my money where my mouth is. Because your body is amazing, and you're amazing. Okay? What do you think, Andrew?
No, totally agree. And I've also heard of polyps, which it is said can become cancerous.
Well, they're warts.
And
Polyps are actual warts inside your intestine. And this is because the environment is so toxic and so stagnant. What came first, the mosquito or the swamp? The swamp. And now you're growing these things. And I'm telling you right now, you go ahead, Andrew. But yeah, this is it's an easy ride for us.
Yeah, and this is aiming the Cellsonic at that area and making the corrections. It'll do it. And as you say, the diet. My method is cycling and oranges and fruit. You can't get constipated if you're cycling up hills all day.
Hey, it's called move it or lose it.
Yeah, exactly. We're cavemen. I always take you back to being cavemen. That's what we are.
Hey, look at, well, you know what? Look at nature. The bear, he wakes up, he stretches first, right? And then he goes and either has a really good dump, or he goes and he hydrates and gorges himself with water. But the big dump, the water, the stretching, we don't do that.
No, and
No.
we should.
So the same person with the bowel problem had a barium X-ray, and I just want you to know that the medical system was told 50 years ago that that the barium X-ray causes more problems than it's worth, and they shouldn't be doing it. Just so you know that. And I hope you know you just jammed up your bowel again, and that's going to backfire on you. And here's the deal. Unless you're in a life-threatening situation, stop doing life-threatening things. And please just give nature a chance. Give your body a chance. But the reality is you've been taught that your body is attacking you and that every symptom you have is something you have to kill. Well, you do know you're killing yourself. Because every symptom you have is your body going, I love you, for God's sakes, will you listen? But you don't know the language of body talk, and I get it. But this is our job to teach you that, especially if you come to Extapa. All right. Darlene, how does this pertain to epilepsy?
He's back to the control of the mind now. And I believe that we will be able to do something about that. Well, I think we probably can, but we shall get into it gradually with
Right.
people trying it rather than us taking people to we don't experiment on anybody. Somebody will try it and I will hear about it, but we don't do experiments. Everything we do, everything I tell you we can do, we know the outcome of it. And I do think epilepsy is something where we shall eventually be able to show that it works.
Absolutely. Brenda, I heard yesterday you can treat, oh, 1 second, I have to just bring this up. I heard yesterday you can treat eyes directly. Can you treat the brain to heal the retinas? I have all the effects, the optic nerve and retinas. Can I say something before you start? I just want to tell everybody something. Blue light from your computers, from your phone, from the LED lighting, from your television, from going to a movie, looking at a computer, working on a computer. Blue light is the most toxic thing on the planet today. Meanwhile, everybody accepts it into as if it's a friend. Understand, when you've got eye disorders, remember something. My great-grandfather and grandmother used to read by candlelight, and they lived into their 90s, and all they did was read by candlelight. Understand something. Our eyes are being destroyed because the brain is being destroyed. Your eyes do not see. Your eyes only pick up light and frequency. That comes through your eyes. And so now with blue light, it's the most dangerous light to take in. You cannot do that. The only time we have blue light is 12 noon. So people take in blue light all day long. So what happens is too much blue light is burning the brain. It's burning out the neurons. It's burning out the synapses. And that's what's destroying our nervous system and causing most of the neurological diseases. So you may not know this, but 10,000 teenagers a day are actually being diagnosed with cataracts. Go figure, teenagers. Yeah, so this is where we're at, the phone, the blue light. So your brain gets burnt first, and then your eyes, they get the damage. Because if you got damaged eyes, you're not going to be on the computer much, are you? Or watching the TV or on your phone. And understand, these are called Teslas. If you don't have Teslas in this world, I don't put them on when I'm doing a show unless my eyes are burning. But Teslas are called, they are fluorine, okay? And fluorine lenses are the same thing as my C60. Remember I was talking about my C60 and the coconut oil? That's 250 times stronger in vitamin C and the strongest neutralizer of free radicals. Well, guess what? That's the same C60 that we drink, same C60 that's in these lenses created by Tesla. And if you wear these glasses and you change your diet, hydrate better, and you do the C60, guess what? How many people know that I wore prescription glasses and I don't anymore? I have perfect eyesight. So how do you do that? Well, you heal your brain, you heal your eyes. And we already know that the Cellsonic, it heals the brain more than anything else. Take it away, Andrew.
Yes, it is doing. What I can't do is say to people, this will work on the eyes, because I don't know. I'm the spider in the middle of the web. receiving information from my customers who've treated their patients. And until I'm convinced of it, meaning reports from lots of different countries on lots of different patients, then I'm sure, then I will tell you. And people will try things. You might have a patient come to you in Mexico and say, and that patient insists that you do it. Okay, then you'll do it, and you'll do it gradually. And the same thing can happen in India and Malaysia and so forth. And slowly we will discover it. We don't experiment on anybody. That's important.
Yes, and I'm not going to work around the eyes because I don't need to. I've got enough tricks up my sleeve that, we don't need to do that. Like, you have to understand something. We are not going to use Cellsonic as a silver bullet therapy. We do not do that. We look at whole body healing. We look at the mind. We look at the person. We look at the physical body. We look at where the physical blocks are. And remember something, whether you believe this or not, if you're limping, okay, and you've got a brain problem and you're limping, that limp is caused because of displaced calcium and scar tissue. We need to get rid of that down in your ankle as well, because anything that increases the flow in the body is then going to increase the mind. But understand, if you've got any type of eye problem, you've got any type of brain problem, what we're going to do is we're going to go into your spine. I want everybody to think about this. Did you know that most of the information that you operate from comes from your core? That's right. It comes from your large intestine, and it comes from your pelvis, your ovaries, your uterus. That's where the information comes from, everybody. And with men, it's from the prostate, and it's from the large intestine. Okay? It really is. Where do you think that information goes? And when I say it's from the large intestine, it's coming from your bacteria. Your bacteria are not your second brain. They're your first brain. So you need to get that. And guess what? Isn't it kind of funny how the medical system just attacks them, and I tell you never to? So now your bacteria will talk 9 times to your brain, where your brain only talks once to your bacteria. So who's really in charge? So that information from your bacteria is put into your pelvis. Where do you think it goes? You ever hear of the coccyx? It's the coccyx tip. That information goes into the coccyx tip, where it goes into the spinal fluid, which has more light and information than any other fluid in the human body. That goes up your spine, and also there's nerves. And there's like all of these nerves coming off from the spinal column that are picking up information from all of the organs all the way up through your core and through your body. I hope you're with me so far. Follow this. All that information goes up, and guess what? It goes up to the brain, drops off information. The brain goes, okay, this is what we need to do. And all the information comes down, and it goes to where it needs to go with the chemicals and hormones and information to tell the body how to heal itself. Now, what if your bacteria have gone bad? What if you've got scar tissue in your core? What if you're pooping in your pelvis? Now, here's the deal. I will do this anytime anybody wants to come. We've shown it many times on testimonials. Go to look at my testimonials. Anyways, and we show you the measurement. When we work on someone, we go with Wolf non-surgical before we do the Cellsonic. And we got to work on any type of the body. And we'll go in between every vertebrae and spend an hour to an hour and a half, depending how much scar tissue's in there. And guess what? People don't lose calcium to lose height. If you lost 2 inches, the first treatment we do, you're going to get minimum an inch back to an inch and a half back in your height. So what happens if we're get rid of the scar tissue and we restore the discs? You know, those discs that are thinning out, we've got to replace them, you've got to have surgery. We can totally restore them. If you've got a slip disc, which there is no such thing, what do it do? Slip down your underwear? Okay, so the reality is it's still there, but it's dehydrated because of the infection causing inflammation, causing scar tissue formation. Didn't you ever see anything that got dehydrated? It shrunk, didn't it? That's why the discs shrink. We'll get them back to the right size. You'll get an extra inch or 2 inches back to your height, and now you've got all that information flowing properly, because everywhere you're calcified, everywhere you've got scar tissue in between your discs, those are little beaver dams. And nobody ever talks about this. You can go to a chiropractor and have your spine adjusted, which can save your life and make you feel so much better. I totally agree. But it'll just pop out because those little tendons and ligaments, okay, they have shrunk because they're dehydrated. How about we get the flow back? I want you to think about that. Now let's use the Cellsonic and just turn it all on. So the reason why I talk strongly and I stand in my power is because nobody else is doing it that I know of. And nobody talks about this stuff. So I have to be very powerful and strong because I've got to come up against 10,000 times somebody telling you that there's no way out. So I got to come and go, "Rrr." It's not really cool. But the reality is I'm alone out here. Thank you very much. All right. I'm hoping to go to Mexico. This is Debbie. As soon as my finances come together, I will call and schedule. That's right. I get it. But you're coming down there not for treatment. You're coming down there for training. You're coming down there to change your life. So when you go back, you know how to hold the line. Remember something, that when you come down there, we're going to be meeting at the pool most days for 2 hours, just talking with everybody who's coming there, just to talk and get to know each other and get to understand each other. And at night, we're going to sit around a fire from 7 till 9 and talk about our heart desires, our passions, and what we'd like to see in our life. We have to come together again. We can't fall apart here right now, guys. We've got to come together. Okay, let me see if I can find any more. Okay, that's not about this. Gene, I never had veins showing in back of knees until I had knee replacements. Well, come on. You know, you put in the greatest physical block that you could in your knee. Now, if you want to get rid of those veins, okay, get a clapper and then get vein away and rub it on there. But start clapping around the area because you have one huge physical block, okay? We weren't meant for implants. Do you know when you have a sliver, it irritates you, right? Well, geez, look what you just put in. Something this big. So, yeah, and it's not alive. It's dead. And guess what? Even when they tell you that you're bone on bone in your knee, with Wolf Non-Surgical and the Cellsonic, and whether it's in your hip or whether it's in your spine, you're not going to surgery. Okay, so when you're done eliminating God, what God created, and you decide you want to go only with man, just know this, mankind's not kind, he's a little liar. Okay? Well, it could be a big liar.
On that question, which we could take as varicose veins, Cellsonic is very effective. And people should be warned about the treatments which involve cutting the varicose veins and pulling the veins out, because that leads to all sorts of side effects and infections and generally doesn't work.
Thank you. Karan, they told me that except there is nothing more we can do for you, my organs were shutting down, autoimmune diseases. Autoimmune disease, just that you attacked yourself on an emotional level because you didn't know what to do, because that's frustration, anxiety, and panic, and it's not your fault. And then, what happens is then you get leaky gut. That's what an autoimmune disease. You got to be pooping into your body, because it's not like you were cursed by God. These things are not. These are not mysteries. They have to be mysteries because pharmaceutical drugs is all they want to do until you shut down your body so much that the inflammation continues until you need a hip replacement or you need some artificial limb, and then when you get that, then you're just gonna have more drugs anyways, and then it just goes on and on. Here we go. Autoimmune diseases, vertebrae all over my. Okay, organs were shutting down, vertebrae all over place. Unable to sit, let alone stand, no vision, hearing at one point. I have done it all myself. I'm not sure what she wants. But the reality is none of this has to happen. And the reality is this can be reversed. The reality is when are you going to matter? When are you going to matter? Until then, your matter is not going to change. Until you matter, until you love yourself well. What, you know, people say to me, I can't afford. You know what? I'd rather be in debt, and I know you, but don't come to me, please. Just go to someone else. I'd rather be in debt and healthy, okay? I don't care how much debt, and be healthy. Because at least if I'm healthy, I know I can pay it off if I wanted to. But even if I didn't, who cares? Money's an illusion anyways. You know, people feel so bad when they go into bankruptcy. It's just an illusion. I'm not telling you to go bankrupt. I'm telling you to get a new attitude of gratitude and understand you can rock your world. Let me see what else we have here. Jean, my stepdaughter-in-law is bleeding from colon and due for colonoscopy. I have tried to get her to at least look at your programs. Just get her to go to the library or send her a link to how to become number one at the art of number two. if I can just say this and then you can talk about the colon bleeding, understand something. First, you got to have stagnation, okay? Which is constipation. Constipation doesn't mean you don't go to the bathroom. It just means waste is getting stagnated in there. And what happens when it stagnates is the bacteria turn into what we call endobacterium. They give off a gas. You only have one cell lining thick in your colon. It burns the lining. So it becomes very acidic, but it actually burns and eats away the lining. So what happens is now she's making holes and it's bleeding. If it's bright red blood, it's not so bad because it's closer to the end of where the rectum is. If it's dark red blood, not so good. If it's black, not good at all. And understand, let her go for a barium when she's already bleeding and watch what that's going to do to her. It's going to rock her world upside down. That might take her to surgery. You think I'm kidding? Guess what are you going to do with all that calcium chalk that's in her bowel? And it's toxic. So she's already got a weakened bowel. It's already inflamed. It's already in spasm. How well is she going to get rid of it? Go ahead, Andrew. I would be really telling her to get though a consultation from one of my master trainers. And everybody needs to know this. What do you think I do from around 5:30 in the morning till about 7 o'clock? I go through all the case histories that are coming in, and I talk to everybody about their consultation. That's the reality. So, unless we're going to provide lots of support right away and on a continual basis, I don't know. I don't think people have a chance. Go ahead, Andrew.
We've got a doctor in London, and the colon is one of her specialities. And with the Cellsonic and the irrigation of the colon, she would work on that patient. And I'm sure, because she understands all those problems, as you say, there's the different colors of blood, which indicate how seriously damaged it is.
Yes.
And she knows what's got to be repaired. And what's passing through the colon, of course, has to be sorted out with advice on the diet and the exercise. You can provide the whole package.
Yeah,
what you're going to do in Mexico.
Well, just know this, everyone, just so you know, and this is not me trying to blow my horn, but I want you to take this home. When I was 30 years old, only 30, okay? Let's go back a little bit. When I was 27 years old, I opened up the North American Institute for the Advancement of Colon Therapy. I opened up the first colon therapy school in Canada, the second one in North America. Okay, my manual, which I still have today, was used by the United States Senate to study colon cancer. Are we done yet? The large intestine is the holy grail. It is the mother of 85% of your immune system. You either love that well or spend your life in hell, and that's it. Your bowel movements matter. And when you get a consultation from us, we show you exactly what every bowel movement should look like for every age group and what it means when you have a certain bowel movement and what disease is going on in your body. We show you what your skin should look like, and when you have certain skin problems, we show you your tongue, your eyes, your hair. We talk about what your breath means. We talk about the shape of your body. And this is real science, okay? Not this other stuff where you get your blood tested under blue light. Did you know that every test that's done under blue light is fraudulent? It has to be done under natural sunlight. End of story. Now that's science. Are we done yet? All right. Shell, got my appointment with Dean in October. Later after Christmas, planning our trip to Ixtapa. Yeah, I'm going to get taller. LOL. You are. Okay, can this help with sinus problems? This is from Ren. And sleep apnea. We talked about that earlier, love, but maybe Professor Andrew wants to say something.
My approach on that one would be lifestyle first, rather than Cellsonic. I'm not going to claim that Cellsonic can do everything. And sinus is something which I've always had, I think. To me, it was normal. Until I was about 12. And then I was doing longer distances on the bike, 100-mile rides and things like that. Never had a problem since. Yes, I still get hay fever. But if you keep riding and you're not too worried about what's your eyes running and so forth, we can't always be looking pretty. The body will clear it through. Just use your body physically, as we're intended to do. I heard a very good quote from an Italian and an old man, and he said, look, years ago, it was 90% body, 10% brain. He says, now, the way people are living, it's 90% brain, 10% body. We're not using our bodies. That shows you where things can go wrong.
All right, so if I could come back just a little bit, I'll just say that sinus problems, cut the dairy out right away, cut the cheese out right away. That's a big one. Next thing is that sinus problems are inflammation and fungal problems. Sleep, and this is all reversible with lifestyle. So I'd get a consultation. You know, I'll give you $150. It's $150. You get a money back guarantee from us. You don't even have to talk to me. You can call up, and you can go, I want my money back. That's it. You know, but people don't do that because we put our hearts into you. Sleep apnea. Sleep apnea is caused, again, believe it or not, yeah, there can be lung problems because of inflammation, because of infection that creates lots of mucus congestion in there, so you're not breathing right. But are you ready for this? It's because you've been terrorizing yourself. Sleep apnea, it's a terrorization problem. You're stressing out and you're going to go, I didn't stress out today. No, you're always running anxiety. So by the time you get to bed, you're exhausted and you can't go to sleep because you're burning your nervous system out. You haven't got a lifestyle that is creating peace and calm. Are you going to tell me that people with peace and calm don't have a good night's sleep? Are you going to tell me that people that are happy about their life don't have a good night's sleep? I'm going to tell you, you don't know what you're talking about. Because the reality, if you've got nothing to compare to, I can remember when I was younger and I didn't realize that it was okay to love myself, care for myself, hold the Braveheart line, and just, stop blaming the world for anything. Take total responsibility, Daryl. And once I realized that I had the potential, my potential was unlimited, I have no problem sleeping. And whatever I get done today is what I get done today. Tomorrow's another day. Okay? When you believe that you're not enough, when you believe that you're not smart enough, pretty enough, strong enough, when you believe you don't have the smarts to be able to maneuver in life properly, that's when you're not going to be able to sleep. But meanwhile, you're going to say, I am not even thinking about anything, but I can't sleep. Because now you're running a program so long and so strong that now you have I can't sleep program. I can't sleep. I can't sleep. You know, people will get up to go to the bathroom and they'll say, I've got problems and I can't go back to sleep. Well, the reality is this. When I have to get up in the bathroom at nighttime, I don't just, if I wake up, I know it's not because I have to go to the bathroom. There's always urine in your bladder. And I'll get up and I'll be quiet and I'll sit because God only whispers. And that's the best time to learn about yourself. So be calm, go to the bathroom, get rid of some urine, but that's not why you're waking up. So the reality is this. Really try to connect with your inner self and learn that unless you become the master of your mind, you'll never be the master of your body. So you are actually the terrorist. Okay? And I don't mean to be so...
It's interesting.
Go ahead.
Let me add to that, Dr. Wolf, because it's interesting and you're reminding me of a man I knew. And he had this apparatus that he clamped across his nose to help him sleep at night. So he could get constant flow of oxygen or something. And I thought that was what his problem was. But what you're saying is more interesting because I then learned from this chap that he had psoriasis. And he said it started when he had a lot of stress. So that's the key. That's the clue. It was this stress, this anxiety. And he went on and had marital problems and so on and so on. Well, first, you're right. You have to get at peace with yourself. You have to be at peace with yourself. Otherwise, nothing else works.
First of all, we need to understand something. It's called victimitis. First, we become a victim emotionally. And it's not because you chose it. You didn't choose it. My God, we get out of school after 12 years and we don't know how to think, drink, eat, or love ourselves or anyone else. And then we go and we have kids and we don't even know how to raise them. The reality is the whole thing is a setup. So don't tell me about anything about, the longer and stronger that you're in any approved government educational program, you're messed up. You're messed up. That's it. So the reality is this, we don't know. Because the whole thing is a setup. You got to understand, the Rockefellers write all the books that are in every school that is approved by the government. Look at the Naturopathic Association. Do you know what they do now? They prescribe drugs. They cross to the dark side. Do you understand that? The only really true naturopathic organization in the world is the World Organization of Natural Medicine, which is the only organization I'll ever belong to. I gave up every organization because nobody's going to tell me what to do and when to do it. And understand something, organizations and systems they're entities. And guess what? They don't have a beating heart. They don't have a blood supply. They just have a bottom line. Okay, Linda, can it straighten out the hands from crippling from rheumatoid arthritis? Well, between Wolf Non-Surgical, by learning how to do clapping, learning how to do one-shot therapy using a shot glass, we actually teach that to you. Because you got to go in and remember, I already told you, your ligaments and your tendons and your tissues are dehydrated. And you do that and you use the Cellsonic, and then Andrew can tell you that people are turning this around without the other stuff. So the other stuff is not costly, and you do it for yourself. We just teach it to you, and then we use the Cellsonic, and what do you think, Andrew?
I think it was yesterday. And a lady in Kent who's got our machine was telling me of the treatment she'd done. And one of them was to her accountant. And she treated the lady's hands. One treatment and everything's working again. The pain is gone. The fingers are now working like they used to do 20, 30 years ago. They don't understand how it does it. And I'm not sure we can blow by blow explain how it does it, but we can see that it does it.
Right.
That's what matters.
Kathy, can my 89-year-old mom use the infinite iodine on her skin as she is on thyroid meds? She can use it on her skin, but you can spray it. It's pure. It's not going to mess up the meds. And if she still has a thyroid, believe it or not, with the infinite iodine, she can wean herself off of the meds. And I'm not trying to tell you anything except the truth. That's it. And the infinite iodine, remember, it's non-toxic. You know, you could take Nascent or Lugos and take too much and blow your thyroid out. That's right. And it's not pure. But infinite iodine is pure. And it's also 10,000 times smaller in molecular size than any of the other iodines. So she should be spraying the back of her throat. Why not disinfect her? And if she has a thyroid problem, get her to use the infinite iodine to get rid of the infection. Some of that will turn into iodide and go to her thyroid. But why don't you give her 5 sprays of iodide and 5 sprays of iodine, and then call me in a few days and you're going to go, oh my gosh, she's actually thinking better. She's actually feeling better. She has more energy. Okay? Terry Lynn, what are your thoughts on, oh my gosh, iodine and Hashimoto's? Well, here's the deal. It's going to be amazing. Our iodine, I wouldn't be using other iodines because you can't regulate it. With our iodine, you can't OD on it, can't do too much of it, you can't hurt yourself. But understand, Hashimoto's is a person that terrorized themselves to the point they blew their thyroid out. And that's it. No way. No, that's it. Now understand something. They did take iodine out of all foods in 1974. And when they did that, thyroid problems went up, and obesity went up, and sickness went up. Iodine is needed to create healthy, perfect cells. And understand something right now. Everybody needs iodine every day. So if you don't live right on the ocean, if you're not getting some iodine from your foods, 5 sprays a day keeps the doctor away. Okay? Darlene, I had died. Iodine was not available when I ordered the iodine. It is available now. We actually sold out. Everybody, I bought enough iodine and iodide, infinite iodide and iodine, for 4 months. And I know it's going to sound crazy, but we actually sold it in 36 hours. So we had no idea. But now we're in full production. Rodney, would this help lower lumbar spinal stenosis? Well, understand something. Spinal stenosis is scar tissue. It's a scar tissue issue. If you did the Wolf Non-Surgical and you did the Cellsonic, I promise you, I'll give you a guarantee on that. Bam! End of story. Yeah. End of story. Hey, Andrew, end of story.
Yeah.
Yeah.
Totally agree.
Yeah.
Totally
so
agree. That
story's over. You know what? The mystery, the complication, searching. No, it's over. It's over. Thank you so much, you wonderful souls. I think we're almost there. Okay, I was diagnosed. This is Marcel. I was diagnosed with bronchial bronchioltaxis. Which is everybody inflammation, chronic inflammation of the bronchioles, which is part of the lungs. Okay, all right. What will Cellsonic do for this condition, and have you treated it before? Let me tell you something. Remember what I told you? Clapping. Okay. You can also use lung restore, but you better be doing the infinite iodine and nebulizing that. And guess what? We can also go in between your ribs with any lung condition. You know that if I go in between your lungs with Wolf non-surgical, I'll increase your breathing by a minimum of 30% in a half an hour. Go figure. Because guess what? The intercostal cartilage, which is the muscle in between the ribs, is actually crystallized and got scar tissue in it. So we're going to open that up so your lung can open up. That little bit of movement with your ribs helps to fill up your lungs. And then when you use the Cellsonic, I think that Andrew can tell you what that'll do.
Yeah, the closest we got to that would have been that COVID treatment, which was done in England, using a protocol which I'd described March 2020, more than a year ago. And I wrote that actually for India and did say that they should do the treatments outdoors because it was better for the person doing the treatment. It was safer. No, it's straightforward. You treat the throat, you treat the lungs, you're killing infection without any drugs. And the effect is immediate. It doesn't take that long to kill a germ. You're talking seconds.
Thank you. So Terry Lynn, could it help with a pinched nerve around C2, too close to the ears? Okay, I want to say something right now, everybody. We're not going to damage the ears with the Cellsonic. Yesterday when we did the interview, and he said, well, that's putting it right on the area. And you know what? That doesn't mean it's going to happen. You know what? Professor Andrew is going to be, he's going to be over the edge with safety. That's what we do. We care for each other. But understand something. I'll tell you this much right now, Terry Lynn. We will take that pinched nerve, and within 25 minutes, it's gone. Okay? We're going to go in with Wolf non-surgical, and we're going to work around the C2. We're going to get the displaced calcium, loosen that up. We're going to take the fibers that are all wrapped around there because of the inflammation, pull it apart, and then we're going to go in there with, what do you think, probably 15 to 30 shocks? We'll do it, won't it?
Okay.
What do you think about that? 15 to 30 shocks?
Not straight into the ear.
No, on C2. C2, cervical, right? C2, right here.
Oh, yes. No, that, you see, is a standard protocol. You go up the spine.
Yeah.
You go up the back onto the top of the head. All that is done. And I know of one doctor who's doing this, whatever it is he's treating, he always does the spine, right up the back of the neck onto the top of the head. And his argument is that this is sending out messages into the rest of the body. He's getting very good results.
Okay. Rosalie, well, that's why we go in with Wolf non-surgical and open up your whole spine. We increase your spinal fluid flow by 20 to 30%. And then we go in with the Cellsonic. Bam.
Yeah.
Rosalie, what about an AFib? AFib is not enough alkalinity. It's acidity, not enough oxygen. Your heart is going, it's not getting the alkaline minerals, and it's not getting enough oxygen. So there is a problem here. Not a life-threatening one, but you don't want it to go on forever. And also, what else would cause AFib? Well, who does this? Anxiety, panic. That's what creates it. That creates the acidity that eats up the oxygen, that eats up the minerals. Okay? Hospital with an event, never had one before, 60-year-old female. And if she actually takes a look at it, the last probably 3 weeks prior, she's been stressing out about something. But the reality is of course it's going to help. What we're going to do if you've got AFib, we're going to go in lovingly with Wolf non-surgical, go around the heart, and we're actually going to take a look at this lady. And if we look at her, even if she's right-handed, on her left side where her heart is, it's going to be higher than her right. And that's because, guess what? She has traumatized the area, and she's got scar tissue built up and protection around her heart because love has hurt her throughout her life. So there's lots of things: panic, loneliness, anxiety. And why don't you talk about, after we do the Wolf non-surgical, we only do that for 5 to 10 minutes, 15 minutes at the max, and then we'll go in with the Cellsonic, won't we?
That sounds good.
Yeah. Does it remove scars from surgery on outside of skin? Well, what we do, yes, it does, and I'll tell you why.
Yeah.
First, we go in and we use Wolf non-surgical because the scar on outside of your skin, the problem is you've got roots, and it can be anywhere from a 1/4 inch to actually 1.5 inches deep. So we go in and do the Wolf non-surgical, which only takes about 15, 20 minutes. And then we're going to use the Cellsonic. And I don't care if it's brown, if it's white or gray. When we're done, it's going to be pink and look like the rest of your skin.
Cellsonic can remove scars. If they're very old scars, it will need that extra treatment you can offer.
That's right.
That's good. But
listen to me.
It'll.
We are so.
If they're healing a wound with Cellsonic from the beginning, the likelihood of not having any scars is very high.
And why? Because you change the message in the cells. Because wherever there's scar tissue, there was trauma to the cells. And just as you can traumatize yourself, you can traumatize your cells. So get rid of the trauma by bringing up the frequency, and you get rid of the scar tissue making. And you actually, remember something, everyone. I want to make this perfectly clear. Where's all the scar tissue go, Dr. Wolf? No, it doesn't go anywhere. Because guess what? Your scar tissue becomes beautiful, connective, healthy tissue because all we did was return the blood flow, the lymph flow, and we restored the frequency that was normal in the tissue. So there's no chunks floating around. It just, wow, what is that? Well, that's what happens when you restore life and balance. You get balanced, healthy tissue. Okay? Carrie Parks. Hey, Dr. Wolf, would the Cellsonic help with my thumb issue in conjunction with Carrie? So Carrie, if everybody saw, we did a live on her. She came, and she has a large tumor, fibroid, not cancerous, but on her thumb. Well, yes, Carrie, it would turn it around. Remember, Carrie, that we're pulling apart the scar tissue, love, to try to bring in the different higher frequency to help to heal the tissue. What happens if we use the Cellsonic and go and loosen this up and then go in with the Cellsonic and we tell every cell, hey, you're not sick, you're healed already. Cells go, really? Really? Did you have somebody go, oh my God, I feel like I'm going to die, I'm going to die. Hey, whoa, stop. Listen, you're not going to. Change the thought, change the pattern. And that's all we're doing. The Cellsonic goes in and it changes the thought and the pattern that the cell is running. That's all it is. Just as you get terrorized, the cells get terrorized and they go into protection mode. What do you think, Andrew?
Straightforward. Just as you say, the protocol you would use is pretty much what we'd use on wounds, which is 100 shocks per square centimeter. That's about the size of a fingernail at energy level 4. And do it at that. But what you're saying is treat well around so that the whole blood system, even go down the arm a little bit.
Well, that's what we did with her. We actually treated her elbow, her shoulder, and we went into her wrist and totally took her wrist apart. And then we went in here and took all this apart. And then we went into the fibroid.
Yeah, that's right. That's right.
Okay. Gene, I don't have a thyroid. Do I use infinite iodine or iodide? Well, actually, you would use infinite iodine. Okay. Linda, does it take a lifetime of treatments or a few treatments? Well, the reality, if it took a lifetime of treatments, then that means it doesn't work. It means it doesn't work. But the reality is, Linda, are you going to come and allow us to do the treatments and then stop drinking, eating, or thinking, or doing those things? Are you going to change your personality just a little bit? Just bring in better things and get rid of the things that created it? Because that's the deal. But understand, if anybody is still coming to us after 6 weeks, and if it's a chronic, super chronic problem after 3 months, then it's not working, but it's got to work. The human body's amazing. None of this is, okay, your body, we're only giving your body what you were supposed to have when you came to this planet, and it was stolen from you. I need you to get that. There is nothing special about me. There's nothing special about the Cellsonic. It is special when we're looking to create balance and to jumpstart ourselves and say, hey guys, you are well. Get healed. Okay? Look at, if people tell you that the end of the world's coming all day long, how do you feel? If people tell you that we're going through a change right now and we're going to have a better world, how would you feel? So we are telling the same thing to your cells. We're giving them a new program just as you would give your mind a new program. Because if you don't, you're a landmine. Okay? All right. Let's see what else we got, and then we're going to have to wrap this up. Because believe it or not, everybody, my container is here on Monday, and everything's gone to Mexico. So we're already shipping stuff. There's already everything down there. We've already got people down there setting it all up. And yeah, we're going to start a new party. Connie, my 7th and 8th nerves in my head have been severed. Can the Cellsonic reconnect the nerve endings? Andrew?
Yes, they can. I'm not sure what she means by the 7th and 8th nerves in the head.
Well, the
Do you
7th and
understand
8th, they're not in the head. She's saying that they've been severed and the impulse is not getting to her brain.
Yeah, this is the severed spinal cord
Yeah.
problem. Yes, yes, that can be done.
Terry Lynn, do you have a list of Canadian practitioners? No, they don't. There's no Canadian practitioners that have Cellsonic.
No, it's starting. It hasn't happened yet. It's starting now.
It's not. Sherry, so glad I never had opted to get hernia surgery, which have been told I was born with. Pain sometimes. Pain sometimes when it gets strangulated. Okay, but guess what? Strangulated, you can get rid of this. You need to start learning how to do some clapping. You could probably use some Wolf non-surgical, and you need to go and get a perfect day consultation and find out how to stop pooping in your pelvis. Start learning how to get rid of the inflammation in that core area, in that pelvic area. Yes, I've been told to get surgery as I could explode and cause bowel obstruction. Please, you know what? That's just over-exaggeration. How many people does that happen to? It's so rare. Why do they have to create fear and panic in everyone? Because that they are taught. Doctors are told what to think. And if they are told what to think more than any other profession. And if you don't think that way, you'll lose your license.
Robots.
Yeah. Michelle, I fell through a floor and ran 2 nails into the up my leg. The medical mafia stitched just the outside of the skin. None inside. I have horrible scars. Okay, let me just tell you this. Between Wolf Non-Surgical and the Cellsonic, you could say goodbye to that. It's over.
Yeah, that's not difficult.
Yeah, that's a walk in the park. And people are going, oh, they're so cocky. No, once you've done something 10,000 times, it's not cocky, it's real. Okay? It's real. All right. Well, I wish there was something to regrow my upper teeth. Yeah, there is. And that would be Dentagen. And you can also do the Cellsonic on the jaw area. We already know that you have more stem cells in your jaw area than anywhere else in your body, and Cellsonic is just going to blow that up with a product called Dentagen, and that's what we were talking about, the ionic calcium. And if you use Dentagen and a little bit of Merigen, and also if you did some clapping and you did Cellsonic, you're going to grow your teeth back. I know you're going, oh my gosh, now it's too crazy. No, it isn't. People who actually get like a tooth pulled out and then they have a big cavitation and they're told they have to fill it, that if you do the Dentagen, a little bit of Merigen, you do Cellsonic, it's going to fill in a few weeks. You heard what I said, okay? So understand something. You think you know what you know until you no longer know it. All right? Wow, this all gives amazing hope for so many. Linda Willis. Sherry. Teresa Hasselaw. I was told born with this hernia, but my doctor wants to do surgery, and I have been putting it off. Just know this. You've got hiatal hernias and you've got inguinal hernias. Hiatal hernias are easier to reverse. Inguinal can be reversed too. Are you going to change your lifestyle diet? Are you going to stop backing up waste in your core, in your pelvis? Are you going to stop getting bloated from eating incorrectly? Are you going to start doing the things? The Cellsonic is going to help to heal a hernia, whether it's up here or a hiatal or an inguinal. Am I right? And do not get the mesh. Get sutured if you have to. But I'm going to tell you something. This is the God's truth. So I have a gentleman. Go take a look at it. It's a testimonial we did. What was his name again? Do you remember? The hernia? The Oriental gentleman?
Inguinal hernia.
Yeah. You just look up inguinal hernia on YouTube or Doc of Detox shows, or where else can they go see it?
Let me look up how to spell inguinal, because that's an easy
Inguinal.
Inguinal.
Yeah. Now, what happened was his hernia was about the size of a small peach. That's pretty ding-dang big. And guess what? It took us 6 weeks with doing our procedure to get it down to a pea. So that last pea is going to take a little while to get rid of. But understand, do you know where his wife called me, Andrew? His wife called me, and they were about to take him up to surgery, and he stopped the surgery. The wife put me on the phone with him. I didn't tell him to stop the surgery. He said, "Can you reverse it?" I said, "Absolutely." And he went home.
Good.
Yeah.
Good.
See if I can bring that up.
Thank you. Linda Willis. Every time I talk to Dr. Wolf on the phone, when I call him, he's like an energy boost. I didn't mean to do this. So I'm not trying to read things to give everybody. He's an energy boost. Just talking to him on the phone. Anyways, I won't talk about the rest. But thank you, Linda. You know what? It's the stuff like this that we get to hear that we usually don't get to hear. That's kind of sweet. Thank you. Kay, Pharma Medicina for osteoporosis infusion costs thousands of dollars and has to be repeated. That won't happen with us. Between the ionic calcium therapy and the Cellsonic and the Wolf non-surgical, I'll give you a money back. And the only way that you're going to have to repeat this is if you're pooping in your pelvis and you have an inflammatory diet like lots of sugar, lots of flour, lots of dairy, okay? You're an alcoholic and you're doing lots of prescription drugs or things like that, okay? So the more acidic you are, the more calcium you're going to pull from your bones. So if you're out of control emotionally and physically, I'm not giving you any guarantee. That's it. It's not happening. Because you have to take massive personal action and love yourself well. Mary, Dr. Daryl Wolf can... Okay. Anyways, I won't say that one because yeah, it's just Thank you, Mary. She's just saying that I can that we can get rid of tumors, which we can, but I don't get rid of the tumor, Mary. My patients do. My clients do, because they take massive personal action. Remember, everything that Andrew does with his Cellsonic and everything that we do with Andrew's Cellsonic and everything that we do with Wolf non-surgical and diet does not work if you don't love yourself well. If you go back home and go back to your old lifestyle, because guess what? The invisible creates the physical. It's just going to come back. And that's it. Am I right, Andrew?
Yeah.
Yeah.
It is.
Okay. Gene, if you have a pacemaker or can you use this can you use the Cellsonic if you have a pacemaker?
Yes, with care. And we've never had a case of disturbing the pacemaker because we're careful. So how much we'd have to do to upset a pacemaker, I don't know. There will be I suppose, a limit beyond which we shouldn't go. and the pacemaker is near the heart, and if they're wanting a treatment on their legs, how much, because you're some distance away, would it affect the pacemaker? Should not, but the answer is do about 50 shocks, because if the protocol is requiring 1,000, this is just going to take long. Do 50 and stop.
Yes.
Make sure the pacemaker's all right. Do another 50 and stop. And just bit by bit. If you're needing to treat the chest and there's the pacemaker, try just 1 or 2 shocks, 1, 2, 3, like that. And make sure you've not disturbed the pacemaker. Be very, very cautious. And that's always my advice to everybody. We've never had a problem.
We never will have a problem because we're going to do gentle baby loving steps at all times.
Yeah, that's
and
right.
You know what? If they have a pacemaker, we're only going to stay below the ribs because that'll be fine. We're only going to do the lower back and everything below that.
Yeah. We're very cautious in everything we do and we never have any problems.
No. Pam, pain changes us. I stay ill. Pam, I just want to say this. God love you, girl. But you run a pain program, okay? You run a pain program. And understand something. We get addicted to pain on a subconscious level. Most people wouldn't know they were alive unless they were in pain. And understand this. If you've had an illness for more than 9 months, it's your friend. That's right. It's called a frenemy. It's actually an enemy, but it's your friend. Because you're so focused on it, okay, that it's your main focus. And whatever you focus on the most, you become. And I will tell you this much. If you were to change your focus, okay, and everything that you do because you love Pam, not because you're trying to fight the pain. Oh, I do this for the pain. Oh, where are you going? I'm going to Extop to try to fight cancer. No, you're not. You're not coming to Extop to fight cancer. I'm going to Extop Palace to learn how to care and love for myself. So when I come home, I can still do it. Do you understand? Come with the right intention. Intention is everything. And you know what? If you got up in the morning with a slight smile on your face and you only focused on what you want and what you love, Pam, you wouldn't have a painful life. You have a painful life because you have a painful program. God love you, and I'm not trying to pick on you. We all have to come out of this someday. Carolyn, good advice. If you don't trust the person, then don't deal with them. And that's what I tell people. If you don't trust me, don't terrorize me, okay? Just do your homework and do your detective work. Go watch my videos. Look what I try to do. Look what I try to say. And look at who I am. Or just leave me alone. Thank you. Sherry, Jean Renee Davis, don't do it. Read my reply on his thread to someone else. There have been TV ads to call. I don't know what that is. TV ads to call about the hernia mesh to file lawsuits. Yeah, just know this. If you get mesh in you, you're going to be in a mess for the rest of your life. Mesh is dangerous. It's cancer causing, disease causing, destroys your neurological system. Thank you for that. Karina, I am curious the cost of the machine in case of purchase. Yeah. So the reality is this machine is going to cost you around $85,000 US, and it's going to go up higher and higher. And I'm going to tell you why. And this isn't Andrew saying it, because I know. Do you see what's going on with COVID? They're stopping the production of everything. Did you know that they have 80% of the containers in lockdown? Do you know why? So we can't maneuver properly, because we're supposed to believe that everybody's just so sick and so dying that nothing can operate anymore. So everything's going to go through the roof. And I don't want to get into the whole political thing, but I'm just going to tell you the price is going to go up, like the price is going up of everything. Did you know that it's costing me almost 3 times as much to get a container and move to Mexico than it would have cost before the C word thing? Okay? So just get that. Everything costs more. You know what? I'm going to tell you right now. I ordered my core twisters, where I teach people how to core twist to strengthen. We can't even get them made, because right now Vietnam is in total lockdown. They're going door to door trying to vaccinate. Did you know that my love bands, I have 100,000 of them being held there because they can't get them on a container? And are you ready for this? Those love bands would have cost me $500 before COVID. It cost me $3,000 US, and that's what it cost me, or I can't have them. That's it. So understand, everybody, this is just to take all the majority of the population, the herd, so to speak, and just mess you up. So what are you going to do? You're going to find your brave heart. You're going to find your smile. You're going to connect to your breath. Are you going to say no to the mask? Are you going to say no to the fools with rules? And understand, rules aren't meant to be bent. They're meant to be broken. So understand something. There's law and then there's rules. And you need to be the only law for you. And that's it. I don't care what anybody says. Nobody has authority over me. Absolutely nobody. And I know that that wasn't part of it, but that's where we're at. That's why the Cellsonic is going to go up in price. Okay? Because we're creating a false disaster. Okay. Linda Willis, your life and quality of life is what matters, not the money. God and the universe will provide. Yes. You know what? And that's the truth. You know what? Have poverty consciousness and see how things work out for you. Okay? Mary, always invested in your health because it pays back in the future. Absolutely, girls. You know, absolutely. Okay, I'm just going to see here. I'd like to say we're done. What would you like to say, Andrew?
Thank you. It's a long session. It's a long session, Dr. Wolf. But it needs saying. And you're emphatic. And you're not afraid to say what you believe. And that's refreshing.
Listen.
How many other people think, if I say what I believe, will it put me in trouble? You don't think like that. You just punch straight out because you believe it.
Well, first
and
of
I'm
all,
a bit like that.
Andrew,
You're like me. We're not answerable to anybody.
Absolutely.
We know what we're doing.
Absolutely. You have to understand something right now. Unless I can live in total integrity, I want to find a new game. And this is the game down here this is planet Earth, a fun-filled, life-threatening game for the whole family, if you know the rules. And the reality is this. 92%, Andrew, of the population has an autoimmune disease. Not one, maybe two, maybe three. Did you know that? Okay, you do know that 81% of the population took the V in Canada. So the reality is you have to understand something. I am not part of the majority, and I look at God love everyone, and I mean that. You know what? People may have different beliefs, but we love them anyway. Unconditional love for them. Do I want to invite these people into my home or have a conversation with them? No. And if I try to talk even somebody who wants to wear the mask or do these things or has a different opinion, I'm not going to try to talk people into my opinion. That's something I did when I was younger because I have no value. I was trying to see if I could heal enough people to prove that I had value so that I had self-worth. I don't need people to tell me that I have self-worth. I'm going to love myself unconditionally whether you like me or not, Andrew. You know what I mean? I'm going to do what I need to do because, believe it or not, I may not be a religious man, but I know that there is a God. And I know that the only thing that God has ever done is unconditionally love me. I don't go with these other rules. I know this, that mankind screws around with everything. The books, everything. There's not a book that they haven't messed with. There's not a teaching they haven't messed with. They mess with everything because it's about control. And I don't want to control anybody. I don't want to own anybody. And nobody has to spend any money with me. And they can go into my library. And I'm still going to do more for them than any other practitioner out there. And that's the God's truth. And I challenge everyone to prove that I just lied. Because the reality is at the end of the day, I only have one energy, light, to answer to. My Creator. I will not answer to anyone else. And it's called unconditional love, total integrity. And I may not hit the mark every day, but I don't care if people judge me. I don't care if they like me. I don't care. It doesn't matter. I love them anyway. And that's how you make it down here. And then you don't make money your goal. But the reality is let's understand this. Nobody knows this. I have 4 videographers working here to produce this show today. 4 of them. Working full time. Where do people think all these videos come from? Where do they think all these free videos, all these trainings come from? From the money that they provide. I don't even own a vehicle. My partner does. I got really beautiful shirts, but I love that. I like to look beautiful. I like to feel great. That's what it's about. You know, I'm not going to make myself look bad or feel bad or do anything like that because guess what? I am selfish enough to know that on this planet, You either love yourself first and foremost before anything else or anyone else, so help you God, or you will become everybody else and everything else. And how does that make you feel? When you take things personal, or when you need approval from other people, it really makes you feel good, right? So that's why when people try to banter at me and try to tell me things that they don't even know, because they don't know me, just as I don't know you, Andrew, but I can get a sense of you. The only thing I know is what comes out of your mouth may be a lie, but I can feel your vibration coming right through here. You're in another country. But Andrew, if you weren't a loving soul, and if you didn't have a big heart, I don't care what you're trying to sell me. I want nothing to do with it. The reality is this. You have a spirit, Andrew, that is peace and love and kindness. And that's the reality. I mean, how did I like it when you told me that, because I'm going to get another Cellsonic, and you told me because of everything going on, it's going to cost me another $8,000. And that was a 1 week. In 1 week, it went up. And I knew it had nothing to do with you. I didn't like it. But the reality is I trusted you just like this. So I'm not trying to give you a sales pitch, anybody watching this show. I'm trying to tell you that, why don't you just use your gut instinct? Use that. Don't use this. How does that person make you feel? You know, you can smell something was wrong. And you know, when somebody's giving you a pitch, when somebody's trying to sell you, they're either using fear or this is a deal of a lifetime, jump on it now. They're using something. You can always tell. But you've always been very comfortable in talking to me. Do it, don't do it, Daryl. This is how it is. And I get it. I get it. And that's how we have to be with everyone. Because guess what? It's a shame, Andrew, but most of the population will not be getting out of pain. They will not be stopping their suffering because they're running a program bigger than loving themselves. And the reality is, you know, I have to be okay with that. And I need to focus on those people that are calling and going, Dr. Wolf, I get it. I want it. What do I have to do for it? I'm not after the people that are on here trying to find holes in me and trying to find out what was he really up to, okay? So the reality is I will choose to love everyone unconditionally. That doesn't mean that I'm going to bring people into my life that have toxic beliefs, but I'm going to love them anyway. I've got relatives that have toxic beliefs, and even though they have toxic beliefs, if I try to put my opinion onto them, you know what? I'd be terrorizing them. You know the old saying, right, Andrew? You can't sell an Eskimo ice cubes.
It'll work. Cellsonics.
Yep.
Big part of what you're going to do. You've got the other part, and the combination is going to be very effective. People are going to be very happy.
And I want to
thank you very much.
God bless you, sir, for putting this all together. And you know what? You have no idea how good you're going to make me look. And you know what? You are.
It'll work.
You are. You make every practitioner out there look amazing, and it's not us. You know what Einstein said? Energy medicine is the future. And guess what? What's the main quote that everybody knows? E equals MC squared. It's always been about energy. It's always been about frequency. And understand that. If you can get the right frequency, you can turn your health on. You can turn your life on. Thank you. God bless, my friend.
And thank you very much. Thank you to your whole team as well. Thank you, Dr. Wolf. Thank you.
You're welcome, my friend.
Thank you.
Have a beautiful day. So everybody, give me 1 second here. Okay. I want to thank Andrew from the bottom of my heart. And he's always been upfront and honest with me. Trust me, it's like this. You have to go through so much to find things. I have bought every energy medicine device. Right now I've got a Beamer. Right now I've got an MRS. Right now there's a new PMF coming out. You know, I had Rife, I had Lahosky. I've had all of them. I've had the Ionic foot bath. I've had the Beefy. You know what? When you ask me about something, I have to buy them all. I got to try them all. Right? That's what we do. It's all part of our life. And so then I put them on Facebook Marketplace. Like I'll be putting a whole bunch of energy medicine on Facebook Marketplace before I leave to go, because I'm only going to keep what really works. But you know, you got to go through all these things. And you know, so don't get frustrated. Stay connected to your breath. Love yourself well, because you are the energy medicine equipment that you're looking for. You are. Because love is the answer. But it isn't the answer. It's what you do with it. Okay? You know what? It's what you do with it. It's a self-serve job. Be thankful, but you won't be until you're thankful. Open up your own heart. Fill it up completely every morning with love from you. Practice mirror work. You know, Braveheart, 3, 2, 1, I got this. This is a kiss. This is a hug. Snug is a hug. Snap yourself back to the present moment. They're trying to own you. You've got to own it. And that means if you're not in the present moment, you can't heal. If you're not in the present moment, you can't make correct decisions. You can't create anything new. You're just going to tear yourself apart. And it's not going to work. Everybody, on Saturday, I'm doing a doc demo. Okay, it's called Creating the Braveheart Love Connection. I have a couple that came in, okay? And this is a beautiful couple. When they came in, they thought it was going to be a physical, nutritional thing, and it turned out to be an emotional thing. And what they found out is guess what? They don't have to be who they are. They can change their personalities to become the reality. Look, if you can't watch it, great, but you know what? It's called Creating the Braveheart Love Connection. Watch this couple and watch what I do with them and watch how we start off from the physical and then I sneak in the back door to the emotional and show them that your emotions are everything, okay? So they're thinking right now, trust me, okay? Now, Monday, and then on Sunday, what's on Sunday?
Sunday we have a product run through.
That's right. Okay, so those of you who do not like product information, okay?
Oh, and it's 4 hours long.
And it's 4 hours long. This is actually a product training I did for my practitioners. Now, for some of you, you're going to go, oh, here we go. I knew he was going to do that. We're all set up now. This is not for you, so please do not come on. So those of you who want to know how my products work, this is for you. It's a 4-hour training. And that 4-hour training is also found where? It's found in my do-it-yourself guide, right?
Yes, and you will be able to find the individual videos on each product-related page in the store.
Yes, and then you'll find each related video if you go to store.docofdetox.com if you want information on the products. That's all that's for. That's not for people who believe that I'm trying to market you. So please stay away from that so that you can just try to be true to me with your feelings with me, okay? Because lately it's been like, there's some people that are not very nice. All right. So Monday, July 26, 10 a.m. Pacific Standard Time, this is the C60 audio. Uncover and discover the true power of carbon 60. Hey, listen, let me tell you something. The inventor of the C60, his name is Richard, and it's just an audio, but I go through and I'll be here. You'll see me live talking about the video, the audio. I'll stop it throughout, and I'm going to prove to you that I have the true C60 in the world, the most powerful C60, and I'm going to show you. So just so you know, I'm not trying to banter at anyone, but make people prove they have good products, because I will do that for you. My C60 is the best in the world. It comes out of Russia, and I'm going to prove to you that almost all the C60 in North America is fraudulent. Now, I may not be liked for that, but you keep on telling me that you want the truth. So Tuesday, July 27th, 10 a.m. Pacific Standard Time, I'll be kicking off the 6-day Advanced Water Fasting Challenge Q&A. So the fast will start on Wednesday. So I will do the Q&A at 10 a.m. And so Tuesday night will be your last supper. Okay, so then we'll go into the fast then. And then I'll be back on with you on Wednesday, where I'll be here to talk about the fast and answer your questions live again, Tuesday and Wednesday. And then I'll be back again on Monday and Tuesday of next week, of the following week. Okay, not next week, but the following week, because I want to really support you. Listen, whether you fast for, I want to talk about that for a second. Whether you fast for 1 day, whether you fast for half a day, whether you fast for more than 6 days, just know I'm here for you. And the water fasting sale with the products we use that won't turn on your digestive tract, but will turn on autophagy and stem cell making, is over 1 minute to midnight on Monday night. So if you want to get them, you still can. And then the C60 sale kicks in 1 minute to midnight. And that's my C60 olive oil, hemp oil, and coconut MCT oil. And with hemp oil and coconut oil, you can put it on your skin. But I'll be doing a show about that next week sometime. I don't know when. It'll be like a 1-a-day thing, and I'll talk to you about it. But understand that C60 MCT oil will heal everything from pimples to skin cancer, and I mean that. And understand that C60, it is 250 times stronger in vitamin C, neutralizes free radicals better than any other product. If you want to bring your brain back and your eyesight, I've never seen anything work like it in my life. And Richard, who makes my C60, you'll be hearing about it. He sells it to the upper military, upper government, and the elites. And I'm the only person that sells it at this level to patients. So you might want to check it out and give us a chance on that and see what you think. All right. What else do I want to say? Not much, just that the New World Practitioner Training, go to www.newworldpractitioner.com if you want to see about coming to Mexico. We're going to be putting more information there. If you want to join us Tuesday night, this coming Tuesday, at 3 p.m. Pacific Standard Time, I will be coming on live and answering all the questions about whatever you have, and I mean it, whatever questions you have, but you got to sign in to newworldpractitioner.com, and we'll send you a link before Tuesday, and then you can come on and listen to practitioners who are coming for certifications, and you can listen to also people who are coming for treatments and also for trainings. We have families coming, we have couples coming, we have groups coming, and then we have a certification on September the 11th. That's 28 days. We have another one on October the 11th, and then we have another one starting in January the 14th. Okay? Let me see if there's anything else. If you want to become a part of our Braveheart Nation, please go to the front page of my website and just take a look at where it says Braveheart Nation and log in your email. I promise I won't banter you. I will just send you information on things that we're doing and what we're teaching. If you want to see all the shows that I can't put on Facebook, please go to Telegram. Download Telegram on your phone, computer, t.me/the Doc of Detox. You can also go to Rumble, the Doc of Detox, or you can go to BitChute. And anybody who wants international orders, you can order internationally on our website, but if you want to call them in, call 250-215-8004, 250-215-8004 on WhatsApp, or you can FaceTime us on that number as well, or you can Skype us at DOD Helpline, okay? All right, I think we're nearing the end here. I just want to say this, that for those of you that are struggling, if you want to take a baby step, go into my library, go to the 4 Pillars of the Perfect Day, go watch How to Become Number 1 at the Art of Number 2, and if you want to understand how you get issues in your tissues, go watch the video, the Emotional Chemistry of Cancer, Disease, and Healing. That's free, and that's a 3-hour training. And then I'm going to give you my other training that's worth almost $1,000, and just go to Masterclass at the top of the page, click on there, and then click on A to Z Wellness and type in Wolf with an E, non-surgical, Wolf non-surgical, and then go in there and then see if 1 and 1 are 11 or 1 and 1 are 2. Okay, I want to thank you for joining me. God bless everyone. Bravehearts, 3, 2, 1, you got this. So what is a New World Practitioner? Well, a New World Practitioner is somebody that understands that training comes before treatment.
Have I noticed any changes in myself since taking this course? Oh, yes. Yes, I have. I definitely have.
There's so much more ahead of you, and there's so much more that you can find within yourself, and there's so much that you can let go of to free yourself. And I'm excited to be able to help others find their power.
It's not a treatment. It's like a restoration. You can renew your body. And I didn't understand what was preventing me from healing.
I guess this is where I kind of get emotional, because Daryl truly cares, not only for himself, but humanity in general, and he wants to educate people to live their best lives and learn to love themselves first before anybody else.
The Whole Life Coach certification. We go deeper in that 8 days than anybody else goes when it comes to learning how the invisible creates the physical, the psychological creates the biological. And we teach you about energy medicine and about vibration and frequency because that's all it is.
He really cares for everybody. He wants to educate as many people as he can, their own healers / practitioners. He wants to get the knowledge out.
Dr. Wolf and the whole crew, Sage and his bodywork techniques, learning it, everybody here has just been so incredible. They're so supportive. It's been a really cool experience.
I've seen nothing but incredible results day after day, hour by hour, while they work on people who get finally the effect and result that they've looked for everywhere else and never got. So they're amazing, amazing.
On a daily thing, I'm becoming more flexible and more pain-free. It's a process of treatments because of the damage I've done to my body. But yeah, I expect to be doing backflips. You know, I'm 64 years old. I'll be doing backflips.
When it comes to the Wolf non-surgical certification, nobody can pull fibroids apart or reverse joint, muscle, tendon, ligament problems or scar tissue from surgery quicker than we can, and we offer a money-back guarantee to all our patients. Now, why would we do that? Because we pull off the I am possible and we reverse the irreversible.
They're so professional yet so fun. They know how to push you to your limit. They encourage you, so it's all positive training, and really every one of them has a piece that they offer to the business, and they don't miss things. They let you go to the next level.
To use my love and light to be in service of others. And that's part of healing, right? Where as my elbow is connecting to that skin, you know, I'm delivering my frequency to the person that's seeking that work, you know, because I will always have that love and light inside me.
And a New World practitioner understands that you can't give what you're not. So until you understand that unconditional love and care for oneself is what you need to become so that you can give that to your patients, don't expect a different outcome than every other practitioner out there. And that's what we teach here, because you need to become what you want to see in all of your patients. Good day, I'm Dr. Darrell Wolf. Do you know why you or your friends or your family are struggling with their health? Well, because they've never been given a strategy. And every time they go to see a health practitioner, whether it's medical or natural, all they're doing is getting Band-Aids. What if we were able to create a strategy that you could create the perfect day from the minute you woke up until you went to bed, and then we continue to guide and support you along your journey as you grow, your program grows. And what if you only paid one price, and you had unlimited support and guidance for the rest of your life? That's called the Perfect Day Consultation.